Do we have a quorum present?
Yes, ma'am, we do.
It appears that we do. Okay. Good evening. Today is October 28th, 2020, and it is 5:32 p.m. As a quorum of the Board of Managers of Central Health is in attendance, I would like to call to order the meeting of the Central Health Board of Managers. The first item of business is the public hearing. This evening's hearing is the official public hearing required by the Texas Health and Safety Code. Notice of this evening's public hearing was published in the Austin Chronicle on Friday, October 23rd, 2020, and written notice was provided to all institutional health care providers in the district. The hearing will begin with staff's presentation of the proposed amended mandatory payment rate. At the conclusion of the presentation, we will invite comments from the public. So I'll now turn it over to staff.
Good evening.
Yes, I think I need to read the first item. Is that correct?
Yes, ma'am.
The first item is 1, receive public comment on the proposed amended mandatory payment rate to be assessed on institutional healthcare providers during fiscal year 2020 under the Local Healthcare Provider Participation Program, open paren LPPF, close paren, in Travis County, and how the revenue derived from those payments is to be spent as required by Texas Health and Safety Code 298E.101. Katie Coburn will be presenting. Katie?
Thank you, Chair Greenberg. I'm going to offer a couple brief comments about staff's recommendation this evening that the board take action to reduce the mandatory payment rate for the Local Provider Participation Fund, or LPPF, down to 2.72%. The FY20 payment rate for the LPPF has changed several times over this year. All of that has been driven by changes in the Uniform Hospital Rate Increase Program. When we set the rate initially in January, the information we had from HHSC was they were not planning to make any payments in Europe. Therefore, we did not contemplate necessary IGT during that initial rate setting. By April, that had changed, and HHSC was, in fact, going to make payments in the program and increase the Europe pool amount available to providers and change the allocation methodology. The board at that time elected to increase the payment rate to 4.17% to take full advantage of payments available in the Europe program under that proposed methodology. Since then, we have yet new information. CMS, the Center for Medicare and Medicaid Services, did not approve a pool increase as large as we expected, and a different allocation methodology, meaning we did not need as much IGT for the Europe program as we had anticipated. Therefore, we would like to recommend that the board reduce the rate to 2.72%, which will reduce the amount of payments required from hospitals during this payment year, and which we hope can help during this volatile year with coronavirus in any case. So I'll stop there.
Any discussion, managers? Mr. Giesland, anything you want to add?
Will you accept a motion?
Yes, I will.
Okay, then I go ahead and move that we.
Wait, Manager
yes.
Valdez.
Oh, we have to have the hearing first.
Yes, we do.
Yes, ma'am. Yes, ma'am. And the only motion on this is to close the hearing, and we haven't taken any public testimony.
Yes. Okay, so then we will move.
Open the hearing.
Yes, Yvonne?
Actually, Madam Chair, it would be Katie Coburn. There's no one from the public signed up to speak, from what I understand, for this public hearing.
There is not. Okay. So there is no one ready to speak, or there's no one present that we know of who wants to speak on this public hearing. So at this time, I'm now ready to accept a motion to close the public hearing.
I move that the public hearing be closed.
There's a motion. Is there a second? there a second, members?
I second.
Okay, Manager Bell seconds. All in favor say aye. Aye.
Aye.
Opposed, same sign. Any abstaining? Thank you, members. The public hearing is now closed. So at this time, I will close the public hearing of the Central Health Board regarding the proposed amended mandatory payment rate to be assessed on institutional healthcare providers during fiscal year 2020 under the Local Healthcare Provider Participation Program. And it is now 5:37. We will now proceed to the public communication. Members of the public who wish to make comment during the public communication portion of the meeting must have registered with Central Health via the online form or by telephone no later than 4 p.m. today. Yvonne, did anyone register to make comments for this portion of the meeting?
Yes, Madam Chair, we've got 3 people signed up to speak, and at this time, go ahead.
Proceed, please, Yvonne.
Okay. At this time, I will proceed with reading the guidelines for public communication. To be recognized to speak, you must request a speaking slot using our public communication online registration form or by leaving a voicemail by 4 p.m. the day of the meeting. Today was at 3 p.m. The deadline was 3 p.m. Individuals are asked their preferred language as they are registered to speak, and both the online form and voicemail greeting are in English and in Spanish. All speakers will be recognized by name and in the order their speaking request was received. If you are speaking, please know, if you're joining us by phone or online, we ask that you keep your device muted until you are called on to speak. Please introduce yourself by name before beginning your comments. Also, if your comments will focus on a specific item or issue on the agenda, please indicate the full item number. Each speaker will be limited to 3 minutes. Staff will be timing each speaker and will announce when a speaker has reached their time limit. To ensure the efficiency of the meeting, once we have let speakers know they've reached their limit, we will allow 30 more seconds to wrap up their comments before they are muted. Once again, speakers will be muted at 3.5 minutes to ensure the efficiency of the meeting. Speakers may not donate their time to other speakers. As a courtesy to others and to be respectful of time constraints, please try not to repeat other speakers' comments. Depending on the number of speakers and the total time being spent in the public communication portion of the meeting, the board chair may, in her discretion, impose additional limits on time or comments. Due to the restrictions of the Open Meetings Act, the board may be restricted in discussing any items that are not listed on the agenda for this meeting. The board may choose to set aside any new issues for discussion at a future meeting. So at this time, I will call on the first speaker. The first speaker's name is Ms. Jill Ramirez, and she's here representing the Austin Latino Coalition. Ms. Ramirez, can you please unmute your line?
Yes, good evening. Can you hear me?
Yes, we can hear you.
Yes, thank you.
Okay. My name is Jill Ramirez. I'm the CEO of the Latino Healthcare Forum. But for tonight, I am addressing you as the proud member of the Austin Latino Coalition. Our coalition consists of 15 trusted organizations, including local nonprofits, businesses, civic groups, and 30 individual members. Tonight, I would like to touch on 3 points. The number one point is we want to thank you, Central Health and Community Care, for all the amazing support that you have provided the Latino community. We want to thank each one of you board members for all the work and support that you have given us, and also the staff that has gone beyond the call of duty. COVID has been catastrophic, detrimental, and traumatizing to our community. And you may see us walking around trying to be the best we can, but we are really living with a really bad situation. We feel like we have a target on our back with COVID, believe it or not. And so the fact that you have our back is a great feeling for us, and we just want to thank you for that and continue working with you. The other point I'd like to make is that we like to work closely with you in addressing the health disparities that took so many of our people's lives. We know the health disparities didn't happen in, overnight and in a vacuum. We know that there were negligence, racist policies towards people of color, and that made our people, being more affected, whether they lost their lives or they're still in the hospital or they're having long-term consequences from COVID. So we ask that for a commitment from you that we work closely together so that we can decrease what happened, and not look back. Well, maybe we might look back to see what happened, but what we know that we cannot change the past. We know that this is a great opportunity for us to write the future. And so we hope that you hear us and that you are able to work with us. The last point I want to make is about equity. And anytime you talk about equity, race, ethnicity, it's a difficult conversation, and we know that. But I assume some of you have taken Undoing Racism training, and in there we learned that in order for us to overcome some of those issues are having these courageous conversations. And so I invite you to invite us to be part of the conversation about equity, to make sure that the right people are participating, because when you look at what happened, sometimes we ask the same people that put us in this position to fix the problem and not bring in the voices of the people that might help us make better decisions. And so
you have 30 seconds. Thank you.
Closing, I want to thank Perla and Celso for attending our meetings and keeping us with what's going on with you all. Thank you, and God bless.
Thank you so much, and thank you for taking your valuable time to be with us here tonight and to share your thoughts. We really appreciate it.
Thank you, Ms. Ramirez. The next speaker signed up to speak is Mr. Paul Saldana, and he's here also representing the Austin Latino Coalition. Mr. Saldana, you can now unmute your line, please.
Thank you, Yvonne. Well, following Jill, I'm not going to repeat what she's already said, but I'm Paul Saldana, another member with the Austin Latino Coalition. We're really proud of the work that we've been doing over the course of the last 29 weeks. Just to give you a little bit more perspective on that, we have served over 12,000 families and provided them free PPE supplies and access to barrier-free COVID testing. And this past weekend, we worked in partnership with your staff, the folks at HEB and Community Care, in providing over 300 flu shots to folks in the community. I too want to thank the leadership of Central Health, specifically all the board members, certainly Mike Giesland, Perla Cavazos, Ted Burton, Celso Bias, and Yvonne for the spectacular work that they continue to do. As Jill mentioned, our Latino community continues to be disproportionately impacted by COVID. You all know the numbers nationally and the state level and locally. We represent the majority of the hospitalizations, the cases, and we've lost over 220 Austin Latinos from the Austin Latino community. I wanted to follow up where Jill left off, and that is moving forward. We definitely want to be involved in any conversations with Central Health as it relates to health equity and the Equity Council. We want to make sure that maybe perhaps we have some representation on that new council that's been created. I also want to maybe move the conversation along a new medical conversation that's happening that's called long haulers, and specifically that's applicable to our Latino community. These are because of folks who are experiencing the post-viral syndrome. In many retrospects, can really incapacitate them for weeks and weeks following the so-called recovery and clearing of the COVID virus. And again, as Cynthia mentioned, as Jill mentioned, the historic inequities of racism, classism, segregation, because of the fact that we grew up near toxic waste facilities. We have fewer access to parks and open space, less proximity to healthcare facilities and physicians, the food deserts, insurance access, the poverty and life expectancies for Black and brown communities is much lower than our white peers. So the conversation now is post-COVID and making sure that we are ready and having conversations to address those in health inequities to ensure that our Black and brown communities are recovering. So again, really just a point this evening was just to call and thank you. I think the last time I spoke before you all, I gave you a pretty blatant perspective of what was happening in the community, and it wasn't intended to be personal, but as Jill mentioned, our community is hurting. We've lost so many people from our community, and we want to thank, again, the leadership from Central Health and Community Care for your ongoing support. Thank y'all. Appreciate the work that you do. Have a wonderful evening.
Thank you. And thank you for all of your support and leadership and all that you do tirelessly for our community with all the others who are involved in your organizations and coalitions. We are deeply appreciative of your collaborations, your efforts, and again, being here with us this evening when we know how busy you are. Thank you so much.
Thank you. The next speaker is Mr. Frank Rodriguez, and he's here representing Health for Travis County. Mr. Rodriguez, can you unmute yourself at this time?
Okay, is that right? Can you hear me?
Yes, we can hear you.
Yes, we can hear you.
Okay. Should I start?
Yes, go ahead, please.
Yes, please start.
Well, my name is Frank Rodriguez. I'm the community volunteer organizer for Health for Travis County. We're an advocacy group that promotes transparency and trying to close the gap on healthcare for our marginalized populations. A few weeks ago, I spoke at the County Commission on the Central Health budget, airing some concerns about the budget, and I'm going to just touch on those a little bit. But mostly, I'm going to go through the agenda tonight and just refer comments and questions on those items. So on C5, under the consent agenda, I want to thank the Central Health Board and staff for entering a contract with the Disparity Expert. I think it's really great that Central Health is finally, signed on the dotted line on that issue. I know a lot of us over time, I was on the board at one point, really promoted the idea of Central Health partnering with the city and the county and the school district, et cetera, on a disparity study, and I'm glad to see that's happening. On the budget, with regard to item 2 on the regular agenda, just want to make the point, and I think you're fully aware of it, the staff has spoken to it several times at budget hearings, of the excess sources of funding, and that a lot of that is as a result of less spending for psychiatric care, pharmacy, and in particular, hospital services and indigent care, which is about 50 million of that total gap, of that total surplus. And our concern is that the hospital model requires a little more transparency than what's been provided to the community. We know that with the concern we have is that excess surplus monies, spending isn't being done as appropriately as it might be. And the question is, we really don't know because for example, Ascension Seton hasn't been forthcoming in the amount of monies they're spending on charity care and medical access programs. And so for us, it's troublesome that you have the resources, but you don't have necessarily the data or the information to be able to really track what you're getting for those monies. And when you're in a pandemic situation, it's really hard to kind of work through appropriate strategies. And then kind of the other item is just with the CCC budget. We still don't think that using district monies to fund a $35 million transfer to the hospital is appropriate. Might be legal, we don't know. And we're asking that question to the board and the staff to really research that and get back to us if possible. Those are my 2 primary comments about the budget this evening, and thank you for your work and your public service.
Thank you for taking the time to be here with us. We appreciate your thoughts at this time.
Thank you, Madam Chair. That concludes the portion of the public communication of the meeting. There are no more speakers signed up to speak.
Thank you very much. We will now proceed to the consent agenda, and members, I do want to draw our attention to expectations for our meeting. As Mr. Davila set expectations for our public communications. As chair, I want to set expectations for this meeting and future meetings and for the conduct of our business. As you will recall, when we were meeting in person, which I know was some time ago now, but in our boardroom, we had table cards. and a poster board that's titled Meeting Conduct Guidelines as adopted by the Board of Managers of Central Health on April 9th, 2015. And of course, even though we are meeting virtually and we're not in our nice boardroom, those are still in effect. So what are those guidelines? The guidelines address the values and virtues of, number one, respect of other points of view, critiquing ideas and not individuals, and being mindful of nonverbal communication. 2, listening for understanding and being open to new ideas. 3, speaking clearly and with one voice. We, not I, right? And 4, seeking consensus through unity and action. Our board is diverse in many ways, which is our strength. Diversity is a big strength of this board. And we should use this strength to represent everyone in Travis County, and more specifically, people whose healthcare we fund. This is our mission. In fulfilling our mission, we often find ourselves in difficult conversations. These conversations are necessary if we are to be honest in addressing topics like health disparities and health inequities, and we know that these exist. However, these conversations must be respectful, and we must be ever mindful that people see and hear your conversations through many filters: race, gender, ethnicity, sexual orientation, neighborhood, upbringing, just to name a few. There have been past instances where conversations have become heated and show that we are all human, but as leaders, we need to make amends. I would like to begin this meeting by reminding the board and staff that we will follow the meeting guidelines from April 2015 that I just alluded to, and that we do apologize to everyone and anyone who has been disrespected, including professionals, community members, contractors, staff, board members, and any others, and that we recenter on the best that we can be when the conversations drift away from our guidelines. Additionally, please keep commentary brief and, to the best of your ability, be clear in your questions for the presenters and for each other. Our board acts as a group, not as individuals, but by a majority. If you want to make a motion for action items for the full board to consider, please do so. I would ask you to refrain, though, from directing staff or the organization as an individual board member. And that is in Section 8 of our bylaws, as a matter of fact. And also, please remember to avoid any conversation that could be considered entering into contracting outside of our procurement processes. Staff has a responsibility for procurement, and we need to ensure that we're not influencing future contracting decisions in meetings or outside of meetings. This conduct is, of course, prohibited by our policies. With that, members, thank you for the time that you commit to this board. I know that it is a very large commitment for our community, and I know that each and every one of you is dedicated to the mission of Central Health and to serving our community. So thank you. With that, members, one of our board colleagues is not feeling very well tonight, and so I want to consider all of the action items near the front of the agenda. With that in mind, we will go into closed session on items 11 and 12 just after item 5, so that all action items can be dealt with as early as possible in our meeting. We also will be taking item 2 out of order as it is not ready for action, and it will be at the end of the agenda, just before we go into closed session then on items 8, 9, and 10. Thank you so much, members. With that, we'll move to the consent agenda. So, consent agenda. C1, approve the minutes of the Central Health Board of Managers September 2nd, September 9, and September 16, 2020 meetings. Receive and ratify Central Health investments for September 2020. Adopt the fiscal year 2021 Central Health investment policy as presented by the Travis County Cash Investment Management Department. C4, take appropriate action on revisions to the Central Health amended and restated bylaws as recommended by the Ad Hoc Policy and Bylaws Committee. C5, take appropriate action to authorize the president and CEO to enter a contract with Colette Holt and Associates for a central health historically underutilized business, open paren hub, close paren, disparity study. Is there a motion at this time, members?
I move that we adopt the consent agenda items,
There-
please.
All right, there's a motion. Is there a second, members?
I second it.
Okay, there's a motion by Manager Valadez and a second by Manager Bell. All in favor, aye. Aye.
Aye.
Opposed, same sign. Any abstaining? Thank you, members. We will now move to the regular agenda. Agenda item number 1, discuss and take appropriate action on the proposed amended mandatory payment rate to be assessed on institutional healthcare providers during fiscal year 2020 under the Local Healthcare Provider Participation Program, open paren LPPF, close paren, in Travis County as required by Texas Health and Safety Code 298E.151. Katie Coburn will be presenting.
Thank you, Chair Greenberg. I don't have anything to add from what I mentioned at the public hearing, but I'm happy to take questions.
Members, are there any questions for Katie Coburn at this time?
At this time, is it possible for you to entertain a motion?
Members, if there are no,
If there are no other questions.
I just have
I have one point I would like to just, as a point of information, is to let you know we will likely be coming back to you in December to set the FY21 rate as well. So just letting you all know that. But apologize for interrupting, Manager Valadez.
Thank you. Manager Musaitov, did you have something?
Yes, thank you. Appreciate it. Thank you, Katie. I just have a quick question. I'm not sure if you touched on it or not. Would this have any financial impact in our budget in any way?
It does not.
Thank you.
Thank you, Manager Musaitov. Any other questions? If not, I will entertain a motion. Not seeing any?
I move that we that the mandatory payment rate be changed from 4.17% to the 2.72% as recommended by staff.
There's a motion. Is there a second?
I'll second.
Okay, there was the motion by Manager Valadez and a second by Manager Musaitov. Okay, all in favor say aye. Aye.
Aye.
Opposed, same sign. Any abstaining? Thank you, managers. We will now move to item number 3, receive and take appropriate action on a proposal from the Health Alliance for Austin Musicians, open paren, HAAM, HAM, close paren, to expand outreach to musicians of color. Kit Abney-Spels, along with Rennie Collins and Rachel Hans of HAM, will be presenting.
Good evening, Board of Managers. I'm Kit Abney-Spels, Senior Director of Eligibility Services with Central Health, and have worked with for many years with the Health Alliance for Austin Musicians on the Central Health Premium Assistance Program. As you will recall, at your September 16th Board of Managers meeting, you, the managers, approved the budget items in the Central Health fiscal year 2021 budget and resolution, along with making a motion requesting the Sendero line item be increased by $640,000 in order to enroll more musicians in the Premium Assistance Program, contingent on the Health Alliance for Austin Musicians presenting their proposal on how they will outreach to increase minority musicians enrolled in the Premium Assistance Program. I would respectfully like to ask, as many of you know, the health insurance marketplace opens on Sunday, November 1st, and will close on December 15th. Central Health and the Health Alliance for Austin Musicians, as well as SIMS, has been actively outreaching and scheduling appointments with foundation communities to enroll individuals into the marketplace. Therefore, due to the short time period in front of us for open enrollment and the time needed to do the appropriate budgeting and sort of transitioning into the plan, I respectfully ask that you do come to a decision on this proposal this evening. At this time, I'd like to turn it over to Renee Collins, CEO for HAM, and Rachel Hans-Blair, Chief Operating Officer.
Thank you. Please proceed.
Renee, you're muted. We can't hear you.
Right. Can you unmute? Renee, there you go. Renee, we
No,
still can't hear you. It might have something to do with your headphones.
I think it is your headphones.
I think it's your headphones. No, you're
now?
muted again.
I'm muted again.
No, you're good.
Now we hear you.
Proceed.
Okay. I wanted to thank the board and thank the staff for our ongoing collaboration and work that we've done. And thank you for this opportunity to come back today to outline further information on our request. The partnership with HAM, Central Health, and Sendero has been extremely successful and has afforded the underserved and vulnerable musician population with access to care and help in navigating the increasingly complex healthcare system. As you all know, the funds we are talking about go directly to Sendero on behalf of Austin musicians who are low-income Travis County residents. These funds do not go to HAM, and we do also incur our own considerable expense to administer and navigate the premium assistance program that we work with you on to ensure that our musicians do have access to care. As I've said before, this program and this partnership is working, and it showcases truly what I think a great collaboration can be between different organizations. We value and respect the work that Central Health provides to our community overall, and respect the hard job that you have to do as you make so many decisions for our city and the health of our community. We appreciate the support. And today we really wanted to come back before you to further explain what our outreach is going to be and ensure that HAM is working to provide services to all, specifically our strategies for outreach to and connection to musicians and communities of color. I'm going to introduce Rachel Hans-Blair, who is HAM's COO, and she would like to get into some specifics of that. But thank you very much.
Thank you. Please proceed.
Good evening. Thank you all very much for the opportunity to come before you and provide additional information and answer any questions that you have about our partnership, the Premium Assistance Program, and our outreach efforts. As you know, this program provides funding directly to Sendero health plans on behalf of low-income Travis County residents. Funding is committed for the fiscal year during the open enrollment process, which starts on Sunday. I am very proud of the work that HAM and Central Health does together and know of no other program like it, actually. Together, we have provided access to life-saving health coverage for thousands of Travis County's low-income musicians. I'm here to make myself available for the questions that you have about our work and to review our recent efforts to ensure that as many musicians of color as possible in Austin are covered by our program. We've been working to not only transform our organization, but the Austin music scene to be more inclusive, equitable, and diverse, and to address longstanding health inequities and disparities in Austin. We have expanded our targeted efforts towards broadening our reach to musicians of color. These efforts are person, program, and community focused, each rooted in strong collaboration with partner organizations. We did provide background information that will go into additional detail, but I wanted to review our community-focused, person-focused, and program-focused efforts. Partnership building and networking, as well as community partner consultation, is a cornerstone of the program. Our outreach efforts really involve boots on the ground work through community events. We have a very personalized approach. We recently completed over 500 personalized outreach phone calls specifically to musicians of color. We've also reached out over email and through any kind of channels that we can, done extensive outreach to find contact information and to proactively identify people who would be eligible. We're working with the Central Health Communications team on collaborative media campaigns and have done outreach in Spanish to existing HAM members and to other Spanish-speaking musicians in Austin, and have translated all of our intake materials, our website, and written communications to be accessible. We are launching a new Q&A and webinar series to educate members and musicians on the process through which they sign up for ACA plans and the Premium Assistance Program, and give them a live opportunity to ask questions. We have done extensive outreach and training on best practices, hiring of bilingual staff, translation, and have formed internal and partnership groups to further continue the efforts and to refine and evaluate them. Our metrics include both outputs and outcomes around outreach efforts, and they'll be presented on a regular basis throughout the process. We expect that as the year progresses, that we will see a measurable impact within enrollment numbers, the depth of connections in our partnerships, and other areas outlined in the programs that we provided previously. Thank you very much for your time this evening, and I'd be happy to answer any questions that you may have about HAM, the Premium Assistance Program, and our efforts.
Members, are there any questions at this time?
I have one also after.
Okay, Manager Musaitif and then Manager Valadez.
Thank you so much, Chair.
And then Manager Jones. So that's the order: Manager Musaitif, Manager Valadez, and then Manager Jones. I'm just taking them in the order I see them. Thank you.
Thank you so much. Thank you for presenting and coming before us. And as the people who came earlier on and spoke of the inequities our community is experiencing, and we're living in unprecedented times. And really, this is an item I strongly support. We need more people in care during these hard times. So I thank you for all your efforts, and I definitely support this movement, and we're on crunch time, and I look forward for us passing this item this evening. Thank you.
Thank you.
Manager Musaitif, thank you so much for your comments. And Manager Valadez, I believe you are next.
Yes, I want to thank HAM and SIMS, both entities, for the work that they're doing with this population. And I want you to know that I am extremely pleased that you are incorporating these strategies to reach out into an other than English-speaking community, because it's not just a Spanish-speaking community. It's the Arabic-speaking community, Asian-speaking communities. It's all those. I have been fortunate to have attended many events where musicians of all different cultures have performed, and music is transcends the spoken word. And I truly believe that because you are focusing on that population that is able to communicate universally, that we need to support your efforts. And I am hoping that we see a huge change in the numbers with respect to demographics. And also, I'd like to know, Madam Chair, if we can go ahead and make a motion to support their request for the expanded outreach of $640,000 to be added to their budget.
Thank you, Manager Valadez. I believe that Manager Jones had a comment, and I certainly do wish that we had some of that music now. Thank you, Manager Jones.
Thank you very much for your presentation, and I, like my colleagues, are supportive of this effort. However, I do have a couple of questions. I heard in your presentation a lot of efforts in terms of what you're doing with language diversity, in terms of bilingual translation in terms of forms and other outreach efforts. You spoke a lot about language diversity and ethnic diversity. Wondering, can you speak a little bit about particularly recruitment and efforts in the African American community here in Austin? As well as, I have a question with regards to, is your focus Austin-wide or just 6th Street downtown area? And so are you looking at these venues outside of just downtown where HAM enrollment can occur?
Thank you very much. So the Premium Assistance Program does focus on Travis County, but HAM's reach is actually broader than that in surrounding counties. And we are not just focused on downtown, we're focused throughout Travis County and all surrounding counties. In terms of your question about outreach to African Americans and Black musicians of color, we are partnering with area organizations and musicians to create materials, communication campaigns, outreach programs, and personalized outreach, and have really appreciated the collaboration very much. And we are taking measurable steps through the creation of videos and other materials. The folks that we are working with have helped us quite a bit in terms of that development and creation. And so we're very excited to launch that and to continue those partnerships, because we believe that it's transformative, and also that is the best invitation to musicians of color and to African American musicians is by the folks who are already members and who are working with us. And so again, we're really excited to do the work and are at the beginning stages of that. Rini, is there anything that you wanted to add, or excuse me?
I'm sorry.
What was your next question, Dr. Jones?
I was just going to ask, do you have any numbers right offhand in terms of African American enrollment?
So I'm going to let Rachel, she may have to look that up, but we do have some numbers. The two things that I was going to tell you is, one of the things that we believe that we're really convinced and wanting to do is, we really want the outreach to be personalized, and we want to be working with community leaders in different communities of color, because we think the best advocate for what HAM does is musicians who already have received those services. And so we have, there's individuals that we're working with already, and that we're planning to continue to add as sort of ambassadors with us. In terms of numbers, I'm gonna let Rachel tell you those numbers, but the one thing I will tell you is that HAM's numbers in terms of our reach in the music community do not match up exactly with how the Travis County demographics match, but they do actually perform better in some areas, or in the areas where we're talking about the music census numbers that we have of musicians in Austin. So I'll let Rachel kind of walk you through that, and then if you have more questions, we can answer.
Thank you, Rachel.
So we do, to piggyback on that, when you compare Travis County demographics to Austin Music Census demographics to HAM demographics, we do outperform the musician population in terms of representation for musicians of color. So that is not an ending point for us, that is a starting point for us. And so we have aggressive goals in those areas to increase that representation. And the question that you had about, I think, quantifiable metrics and improvements with, we are in the middle of our open enrollment cycle. And so when we look at enrollment, we have currently 1,300 appointments scheduled for ACA appointments starting on Monday. And we have reached out to and have over 40 new musicians of color through our outreach program, specifically, not just through word of mouth, but through our program, who are joining us. Those are sort of, those metrics are in the works as the enrollment process is happening right now, but I'd be more than happy to come back and report on the efforts after the open enrollment process completes at the end of December.
Thank you. Okay.
Can I make a motion?
Oh, yes. Manager Musaitis?
I move that the board accept the plan presented by the Health Alliance for Austin Musicians, HAM, to expand outreach to musicians of color, which will result in an increase to the Sendera budget of $640,000 as previously approved by the board.
Is there
A
a
second.
Okay, there's a motion by Manager Musaitis and a second by Manager Valadez. All in favor, say aye. What?
I had a question. You made the motion, but you had no discussion on the motion.
Oh, I'm sorry. Yes, let's go ahead. David, is there anything I need to do procedurally here?
No, ma'am.
Okay,
Motion is
thank
still
you.
pending.
So sorry, Manager Jones. It's hard sometimes when we're not in person to see all of this.
No,
Please.
I understand. I appreciate that. My question, I would like to have amended the motion to the degree that we ask that within 6 months that we have a profile of what has occurred with the investment we made. I hear what the representatives have said. I appreciate their comments, but I think that we've been at this for quite some time, and I just think to go a whole year investing this amount of money without having some assurance of that is actually transitioning into action, I think will be problematic. So I would like to see if anyone would be willing to accept a friendly amendment that we say within 6 months that HAM would report back in terms of the enrollment of people of color, specifically by race and ethnicity and other categories to this board.
I have a question.
Yes.
With respect to what he just said.
Yes, Manager Valadez.
Just in case we don't realize this, the ACA timeline is very, very short. And so we know that by January and February, those that have signed up and been accepted by the feds and been effectuated, that means they've gotten their premiums, that list will be sent back to Sendero, and we will be made abreast of exactly who the people are and what their demographic is. And that's within 6 months. That'll probably happen by, I would think, February, because depending on when they sign up, they could be eligible for a January 1st or a February 1st, I guess, start date for their calendar year. So
yes,
just
Manager
clarifying
Valadez.
that.
Thank you for pointing that out, because that is correct, and that happens with every cycle of the ACA. Kit, yes?
I just wanted to, just to clarify, Manager Jones, this money, the outreach and enrollment will happen by December 15th, and the $640,000 gives us the funds to pay the premiums for the entire year for the additional musicians that we enroll.
I follow that, but my question is, and I think Manager Valadez sort of answered it, as you as well indicated. So are you saying that by the end of this year, we will have those numbers? We should have those numbers.
That is correct.
Yes.
Yes, that is correct.
So I would just ask that we report back by January the 1st on what those numbers look like.
I would respectfully ask that we maybe do it February 1st, because we do have to get folks effectuated and there is a little bit of transitioning, but we will absolutely have those numbers for the February board meeting.
Okay, so Manager Jones, are you suggesting an amendment that we have an update for the February 2021 board meeting?
Yes, that we have a report back at the February 2021 board meeting on their ability to accomplish the enrollment for people of color by category.
Race, ethnicity, languages, so on and so forth. Okay, Manager Musaitis, there's been a request for an amendment to your motion.
Well, based on the information that Kit just provided and what Manager Valdez said, I believe this information is usually provided to us in February, so I don't see a necessary why we should accept this amendment, because we are going to be provided usually on an annual basis. We get this information.
By the time, my experience has been if we put it in motion, it will occur, and so that's why I'm asking that it will be part of that meeting.
Kit, did you want to add something?
I just want to make sure that we're understanding that we would approve these additional funds and that anyone that is enrolled this year would stay enrolled, and that we are not thinking based on what the number report is in February, we would not disenroll musicians or somehow say that that funding was no longer available. I mean, it is a commitment.
So, Kit, I'm going to stop you there because I didn't hear anyone say anything like that.
I just want to make sure.
I didn't hear anything like that. I don't even know where that's frankly coming from. That I didn't hear anything of that nature. What I heard from Manager Jones was that he wanted the demographics presented in the February meeting, period. Is that correct, Manager Jones?
That's correct.
Thank you. Manager Untitled, can you accept that as an amendment?
Yes, I will.
All right, thank you. So there's been a motion, there was an amendment that's seconded. We need a second, Manager Valadez.
Of course, and on to Manager Jones's point very quickly, there could be a back and forth between the feds and Sendero if there's missing paperwork or some additional information is required. So, you know, it's very difficult to tie you to a specific date for effectuation, but I support it. Thank you.
I think this just says that in February we'd get an update at our February meeting. That's the language that is there. All right, members, is there anything else? Okay, all those in favor, please signify by saying aye. Aye.
Aye.
Opposed, same sign. Any abstaining? Thank you so much, members. Appreciate it. And thank you to our presenters and to all who are working so hard on behalf of our community and on equity. We appreciate everything that you're doing. Thank you so much. Okay, members, we will now move to item number 4, receive and take appropriate action on the President and CEO's performance evaluation tool for May 2020 through April 2021, as recommended by the Executive Committee. Ms. Willers and Ms. McNally will be presenting.
Thank you.
Managers, the Executive Committee did take up the evaluation tool in our meeting this afternoon and voted to recommend the tool with 3 opportunities, as you will hear in the presentation. We also discussed the possibility of including a 360-degree review in the tool or leaving that as a separate issue for deliberation and action by the board. Thank you. Please proceed.
Thank you. Good evening, Madam Chair, Board of Managers. I'm Susan Lara Willers, Enterprise Vice President of Human Resources. I hope you all can see my screen. It's a spreadsheet. This is a familiar tool. It's the tool that we've been using for the last 2 years to evaluate the CEO. You will notice objective 1, 2, and 3 are similar. These objectives come straight from the strategic plan priorities that are on the board resolution. And so just to, as a refresher, objective 1, develop and execute healthcare delivery strategy based on people in place. Objective 2, implement patient-focused and coordinated healthcare system. Objective 3, implement a sustainable financial model for healthcare delivery and system strategies through 2024. The other items on the tabs here are the 2020 opportunities, which we will cover in just a minute. Board relationship, which is stays identical to last year's. And then if the board approves a 360 evaluation, we will create it in this tab here. So with that, I'm going to turn it back to Madam Chair and Dr. Bell to discuss the opportunities.
Thank you very much. So members, we did discuss this in the Executive Committee, and there was a recommendation to the board. As you will recall, when we had the review of Mr. Giesland, there were opportunities noted and also responses. And we looked at those, and we have 3 opportunities for this next year. The first is to continue to improve coordination with the board, community care, Sendero, stakeholders, and elected officials regarding decision-making processes and communications. We realize the tremendous job that everyone is doing on this. However, situations are always changing, and we must continue to iterate and improve in these areas. The second one, number 2, is devise and communicate appropriate timelines and financial plans. So these are plans for capital improvement projects with status updates. And as we know, we have ongoing projects, and they are reaching the point of really moving into phases of architecture and engineering and some design. And so what we want to see is plans. And I want to emphasize this, just as we see with, for instance, the City of Austin or Travis County or the Austin Independent School District, where they have capital improvement projects and they have capital improvement plans. These are plans. And as such, they are subject to change. But within these plans, we can look at the timelines for planning purposes and financial plans, and then have appropriate status updates pertaining to these plans. And we will be looking to how these updates occur, such as on our new website and in other fashions. And number 3 is outline the plans and process for systems-based improvement, including personnel and governance. And as you know from our strategic planning committee meetings and from our board meetings, we are have been moving to systems-based improvement in our healthcare system and keeping people healthy and well, and also including personnel such as medical directors and governance as items such as committees. So that is number 3. Board members, do you have any questions or comments at this time?
Will you entertain a motion?
Yes, is a motion appropriate at this time, Ms. Willers?
David, yes?
Yes, ma'am.
Okay, so yes, thank you. Manager Valadez?
Yes, I'd like for us to move that we adopt the CEO evaluation tool as presented to us by Susan Willers and the Central Health staff, and thank them for the work that they've done on this.
Okay, there's a motion. Is there a second? Members? I'm looking. Is there a second on Manager Valadez has made a motion for adoption? Is there a second?
Second.
Manager, thank you, Manager Zuniga. All right. So we'll have to, I cannot see everybody right now, so let's make sure that I hear you. So all those in favor of the motion, please signify by saying aye. Aye. Manager Jones, did you have something?
Usually we have discussion on the motion before we follow through.
I thought I had asked, I'm sorry, I thought I had asked for discussion. Managers, any comments or discussion on the motion?
Perhaps I missed it. My only question is, I asked earlier about the 360 evaluation input. So at what point will we have that? Is that going to be later in our presentation tonight?
Yes, Manager Jones, Ms. Willers, we're going to have a separate presentation on that shortly. Is that correct?
That's correct.
Yes, so we will be having that, Manager Jones. Yes, and our consultant is here with us.
Okay, all right then, thank you.
Okay, and again, I'm sorry for the virtual reality.
I understand.
Okay, so is there anyone else who wishes to speak on this item? Okay, I'm not hearing anyone. I can't see all of you now, but I'm not hearing anyone. So we will then move to a vote. All in favor, please signify by saying aye. Aye.
Aye.
Any opposed, same sign. Any abstaining? Okay, thank you, managers. The motion has passed. I don't think we need this on the screen anymore, and that would enable me to see you all and better respond if you want to have comments. Thank you. Okay, so that was item number 4. We now have agenda item number 5.
Madam Chair,
yes.
the 360 evaluation presentation.
Yes.
Okay, sorry about that. Yes, that is next, so we'll proceed with that. Thank you.
Okay, so moving to the discussion of the 360 evaluation. In previous meetings, the board agreed that a 360 evaluation will be conducted this year. But what needs to be decided this evening is if the 360 evaluation will be part of the performance evaluation or if it'll be kept separately for development purposes. As a reminder, in the late summer, the Central Health staff, we reached out to the City of Austin, some of the Central Health affiliates, and other hospital districts within Texas, and found that only one of those that were contacted used a 360 in their CEO evaluation, and one other company used the 360 evaluation for the entire executive team's evaluation. In addition, we contracted with a third-party consultant, Ms. Diane McNally, with Employee Resource Council, who was hired to assist the board in creating the 360 evaluation questions, selecting the reviewers, and sharing the 360 results with you. Ms. McNally holds a PhD in Human and Organization Development and has over 20 years of experience in assisting and partnering with large companies. This discussion tonight is where the board is going to be including the 360 in the performance evaluation or keeping it separately. Ms. McNally will provide a high-level overview of a 360 evaluation and will open the floor for questions. Ms. McNally will join us in the future to help the board with the questions, raters, and timelines of the actual 360 evaluation. So with that, I'd like to introduce you to Diane McNally.
Thank you. Please proceed, Ms. McNally.
Thank you very much, Ms. Greenberg. I appreciate it. Thank you for your time tonight. The 360 evaluation is used in best practice today. It can take two different forms. One is a very structured 360 where individuals will go out and actually complete an instrument that is has prescribed questions on it. That is a multi-rater type instrument where they select individuals at their peer level, their boss level, and their subordinate level, and include other parties as well. And all of those individuals respond to the same questions across that instrument. And, excuse me, and various reporting is provided from that instrument. The other method that is used, and this is typically used at the CEO level, is a qualitative data collection process where we design a particular set of questions related to the expectations of the CEO role. And we would interview, phone interview or in-person interview, individuals who have knowledge of the CEO's performance. And that could be at any level in the organization, as well as external partners. And we have some criteria for kind of deciding how you would select those participants in the 360 interviews. From the interviews, we do a thematic analysis and bring together and aggregate the information and bring together a summary of those individuals' perspective on the CEO's performance around those pre-described expectations that the board would have of that role. And that typically involves anywhere between 10 to 12 people. You can really have more or less. It depends on your parameters and your expectations and how much data you want and from what level. And the interviews are usually about 45 minutes to an hour. Those sometimes will run longer, but that's usually the how we design that actual process. And over a period of about 6 weeks, perhaps 8 weeks, we can complete that process for a CEO. I'd be happy to answer any questions that you have and be specific to what your interests are.
Thank you very much. Members, let's proceed with questions. Manager Jones.
Yes, I have a series of questions, and thank you very much, Ms. McNally, for joining us. My question goes first to, and you're probably familiar with our operational model here in Austin, Travis County. Most of what we do is finance health services in our community. And so the evaluation of our performance is tied to the evaluation of the CEO's performance. In order for us to assess his or her performance internally, I think the idea of assessing both up and down the system is fine. But given that most of what we do is outside the system in terms of financing, I think it's important for us to be able to have input from those contractors to whom we provide funding, because they let us know how we interact with them. And therefore, I think that's an important part. Currently, we don't have that input directly. So my question is, in our model, one, have you seen this done anyplace else? And are there concerns with trying to evaluate a CEO based upon getting this feedback from external partners, which would be community leaders, contractors, political leaders, and others?
Yes, thank you for that question. It is common to see external partners included in a 360 at the C-suite level, at the CEO and others within their hierarchy, senior hierarchy, both in the private sector as well as in the public sector. We see that happen. And they have different needs and different expectations, but it's very common to see some kind of inclusion of that feedback from those partners who do have knowledge and have a significant impact on how the CEO goes about doing the work of the organization.
Okay, so you're aware of that. I think Ms. Willards, I think, indicated that there's only one other healthcare district in Texas that does that. Could you tell us, Ms. Willard, which district that was?
It was not the health district. It was the city of Austin. They have used the tool for the CEO or the city manager 3 years prior, and then Integral Care used it one time.
So just to be clear, none of our peers, as far as healthcare or hospital districts, have done this. The city of Austin used it 3 years ago once for the city manager, and Integral Care used it once. And was it a separate from the, was it a separate evaluation or included in an annual performance review?
It was part of the evaluation, but the city, when they used it, was it was an internal tool. So only the internal staff evaluated, and Integral Care, Carla, do you remember, that was external?
I don't recall, Susan.
Okay, so with the city of Austin, outside contractors were not part of it. It was the internal staff.
That is my understanding, yes.
Okay. And of course, we do have negotiations with contractors and mediations underway that we would have to be cognizant of. Okay.
But I guess my point also, Ms. McNally, is that we, with the exception of one other healthcare district here in Texas, Nueces County, we're somewhat different in terms of financing as opposed to actually providing health care. We don't run or control the hospitals. We don't run or control our providers. They are contracted to us. And so therefore we have very limited input from the citizens or the providers, ourselves as board members. So my question is, would it be logical, reasonable to expect us to get that input as a vital part of the annual evaluation, not separate from, but to include in our assessment and evaluation of any CEO?
It is, organizations make those decisions based on a number of factors, so it really varies from organization to organization. What I have seen in terms of a common practice is if there are goals and objectives in the CEO's evaluation that is tied to the effectiveness of those relationships on whatever scale or however you would evaluate that, then it would be part of the evaluation.
I'm going to interject here because I understand that Ms. McNally has expertise that she's imparting, but members, I know I don't want her to be in an awkward position. She can't answer really for us. This is a decision this board has to make as to whether we want the 360 evaluation to be included in the annual performance or separately. Clearly, there are questions that we already have in our annual performance that get to how our CEO communicates with the public and with us. But here we're talking about should we or should we not be including people who we frankly are paying as contractors, and we know we are in various processes with them. Also, we would have to look at how and who we include in the community. And I know we can get to that in devising it, Ms. McNally, right? You could assist with that. But it seems like the decision as to whether or not we include it in the performance evaluation or do it separately has to be for this board to decide.
Manager Greenberg, I was in the process of asking her for her opinion. I didn't expect her to tell us what to do. I think as a board member, I have the right to ask her her opinion.
You certainly do. I just wanted to clarify that we would have to make the decision.
I understand that. I wasn't expecting her to do that.
All right, thank you.
Madam Chair, I'd like to make a comment.
Manager Valdez, yes.
What has concerned me for many years since I came onto this board and long before is how we are doing with respect to reaching out, accomplishing our mission, that is reaching out into the population that has no insurance, that has not been enrolled, that is not on MAP, et cetera, et cetera. To me, that is a much more telling picture of how well we are doing our job as to whether or not we have strategies in place to reach out to those populations, and we are reaching or increasing our numbers and being successful in increasing their quality of care and their health overall with respect to the community. Now, I know that previously we did not have anything like that in place, and I have seen big improvements in that since Mike came on as CEO. And so for me, as far as I'm concerned, what's very important is whether or not we're accomplishing our mission. And that's the best, for me, that's a really important gauge for determining whether or not we're doing our jobs, because we are here to provide care to the indigent, to the vulnerable, to the working poor. And that's our targeted populations. As far as I'm concerned, a lot of bureaucrats and politicians are not on our rolls.
Thank you, Mr. Valdez.
That's important to me, just for consideration. Thank you.
Thank you for your comments. Manager Jones?
But to respond, Manager Valdez, no one's asking for that. My question is not to have them to totally be the only evaluators. We're doing well not only because our outcomes, but we're doing those through these organizations. We don't provide 1 ounce of service. We fund it. And so it's important for us to evaluate the way in which we're funding it in terms of the outcomes that we receive. Yes, I'm strongly believe that we need community involvement in the in some aspect of the evaluation. But I also think that since we have a unique model in terms of financing healthcare and not providing healthcare, those arms, those fingers through which we operate, we need to get feedback from, just as the heart gets feedback through the veins and others for its operation, we need to get feedback through our organizations that we work with. And I find it difficult for us to have problems with asking that feedback, not to be determinative, but to get that feedback. I find that to be interesting that we would not want to know that.
Thank you, Manager Jones. I want to add that I think it's what's very important, since we're funding them, is that we assess outcomes from them since we are funding them. Ms. Willers, did you want to add something?
No, ma'am.
Okay, Ms. McNally, we'll turn back to you.
I would be happy to answer any other questions that you have. As stated, it's an organizational decision on how you include your rating, your folks who are rating the CEO. But there are practices and organizations that choose to do that.
Okay, members, managers, other questions? Because I think what we do need to decide, if I'm understanding Ms. Willers tonight, is whether we include a 360 as part of the annual performance review or as a separate review. Is that what's the question that's before us?
That's correct.
And then we can work, Manager Jones, on the exact instrument and who's interviewed and how and all of those things. Manager Musaitif, did you have a question?
If we do it separately, how would that be conducted? And don't you think that will be more efficient that way? So just wanted to get some feedback if we do it separately rather than combining the two.
Ms. McNally, can you respond to that, please?
Well, the data collection process would be the same whether you included it or not. You might make some different choices about the scope and the scale of it, but that would be determined by the organization.
I have a question. It's Julie.
Yes, Manager Zuniga. Yes, please.
Yes, I was wondering about best practices for it to be done every year versus sporadically. Is there some sort of some sort of benchmark that people go by? Do they usually do it once a year or every other year, or is it sporadic? What's best
question? That's a really great question. It's typically every couple of years. And the reason for that is by the time the process has taken place and the feedback has been provided and the action plans, if you will, are put in place, there has to be some cycle of time so we can see whether the person has embraced the feedback or not. So usually that'll be a 2-year cycle. Some are 3, but any more 3 years is a really long time. So we try to look at it 2.5 years.
So you're saying 2.5 years, although we've heard of organizations locally that apparently have done it just once. It seems to be all over the lot as to whether this is something that is incorporated on a cycle or one shot, but I'm sure there are best practices, and thank you for the question and for the response.
Yes, the best practice is 2 years. Doing it once is a point in time, so
right.
It would be difficult to know if the person's embracing the feedback if you don't reevaluate.
So you would at least need to do it once and 2 or 3 years later do it again to see, and then after that make a decision as to any kind of timeline. Thank you. Appreciate it.
You're welcome.
Manager Jones, yes, please.
So are there any advantages, Ms. McNally, in terms of doing it together versus separate as part of the overall evaluation, or doing it independent from that?
One of the driving factors in deciding to include it in a performance appraisal is if there are specific goals and objectives within the performance evaluation that speaks to these partnerships, the effectiveness of those partnerships, and that there may be some action taken as a result of what that feedback might be, whether that would be expansion of responsibilities, some type of compensation action. So that is often you will see if there are actual goals and what we call compensable factors in the performance evaluation, that would be typically included. The 360 would be included in that.
Seem to be tying that to if it's going to affect compensation, included, and if not, do it separately.
Usually, yes.
Okay, thank you for that. And thank you, Manager Jones. Very, very helpful question. Other members, are there any other questions or comments? Because we'll need to proceed to just make a decision here, and then we can work on the actual participants and tools and whatnot with the help of course, Ms. Willers and the consultant. Anyone else?
I just have a last comment to make.
Okay.
And I want to make sure that if we do this, either as a separate tool or as a combined tool, I'd like for us to make sure that somehow or another we look at representation, representative demographic cues for determining, who will be reached out to, who will be included, blah, blah. I really want us to go to and look to the demographic representation of the population that we serve.
Thank you.
So I just want to make sure that that's included and that we understand that. Thank you.
Thank you, Manager Valdez. Managers, I'll get this kicked off as we need to make a decision. Perhaps it may make sense to have it separate if it's something that we're not doing every year, right, as part of our annual performance, and it's something that we're doing separately every at least 2 or 3 years, and then see if we continue. But I will put that out there as a thought. Managers, any responses, any conversation here so that we can move along and come to a conclusion. Manager Musaitif?
Chair, I support what you just stated right now.
Separate.
Other thoughts, managers? Manager Jones, yes.
I hear what you're saying. I would not. I mean, I wouldn't agree. I would disagree with that. I think it should be done as part of the annual evaluation, and for the reasons I've said earlier, in terms of our expectation and the community's expectation. So, for what it's worth, I just want to note that as well.
Certainly, certainly. And as I said, I wanted to start the conversation, and it's,
All right,
it's a
I understand.
conversation.
I
Yeah.
understand.
Other thoughts, members?
I think I would support a separate tool, and I would also like for us to take into consideration the fact that we're going to be going through a disparity study, and that is also some more information that we might need to consider, especially in dealing with contractors. But
Thank you. Managers, any other thoughts here? Like to hear from some others if you have thoughts, if we need to move to a motion.
I'd like to keep it out separate since the best practice is 2 years. So I'd rather
Okay.
have it with best practices.
Okay. Is there anyone who wants to make a motion at this time? Managers?
I'd like to move that we
Hold on. Manager Jones, I'm sorry, did you have something to say?
No.
Okay. Sometimes there's a cough or something. So, all right. Thank you. So Manager Valadez, were you wanting to make a motion?
Yes, I'd like for us to move to engage in this activity, but that it be separate from the, and not necessarily tied to.
Well, there's some language I think we have in front of us. Does anyone have that language? Manager Bell, do you have it? I think, Manager Bell, there's just some particular language that we may need to adhere to.
I think I have it.
Okay, Manager Zuniga.
Go ahead.
I think it is, okay, I might have it wrong though. There's 2 here. I'm gonna do the second one.
Yes, we already took care of the first one.
I move that the president of the CEO receive a 360-degree evaluation with participation by staff, management, and stakeholders of Central Health Enterprise, and that the results of the 360 evaluation will not become part of the formal evaluation.
That means it's separate, yes. Okay.
Yeah, will not become part of the CEO's formal evaluation.
Okay, so there's a motion. Is there a second?
I second it.
Okay, so there's a motion by Manager Zuniga and a second by Manager Bell. Discussion, members? Any questions, comments, discussion? Manager Jones.
I just want for public information purposes. So this board has decided that it will not include a 360 evaluation as part of the annual evaluation of the CEO for this district. If we approve this, that is what we're voting to say.
But we're still
is that
we're still doing the 360, just separate from. So we're still getting a 360 evaluation.
No, that's what I said. I said we're voting not to include it in the annual evaluation.
Right.
I want noted for the public that is what this board has concurred it will do.
We haven't taken a vote yet, but Manager Bell?
No, that will be the result if we vote on it. I want to make sure I'm understanding that and the public understands that.
And perhaps we need some rewording, but Manager Bell?
I have a question. If you have results on the 360 evaluation that sort of connects with, say, one of the opportunities that we put out there, wouldn't we be able to use that information to sort of address whether that issue is being done? I don't know who the question is for, but.
Ms. Willers, Ms. McNally? Ms. Willers?
I think that if we start working with Ms. McNally early in the year, I think certainly we can have the results of the 360 before the actual evaluation takes place.
I have another question. It kind of goes just with that.
Yeah.
Are we tied to, do the results of the 360, can they still be tied to the evaluation in a way that if the evaluations are really good, cannot we consider that in the annual report, or is it not considered at all? Like, let's say a promotion, or those results will still be tied to it, or they can't be considered as part of that.
Right. So tonight you're approving the tool with the 360 evaluation input or without it?
We're just approving the tool.
No, we're deciding whether or not the 360 evaluation is a tool. The question is whether that is part of the CEO performance tool or whether it is a separate tool. Am
Just
I
wondering if we could use the results, not necessarily the tool, you know, that they're.
I would think that in our evaluation, and please somebody correct me because I'm just thinking out loud here, but it seems to me that any information that we have, we can include that in our, if it feeds into the other questions in our evaluation, such as how is our CEO working with the community and others. Is that
it just isn't part of the annual tool?
What?
So the 360 evaluation is not part of the annual tool.
Correct.
Okay.
That's what this motion says. What this motion says is that there will be a 360 evaluation, but it is a separate tool from the annual tool. Now, the question is, I think the question that a couple of you have asked is, if we have the 360 evaluation results beforehand, can we use that information, right, in our annual evaluation? Is that the question?
Yes.
Can somebody respond to that, please?
Ms. Greenberg, this is Diane McNally.
Yes.
If I can be helpful in answering that. It would be, you can use that feedback in your performance appraisal if those expectations are clarified and shared with the CEO, because that's very important to the process, that it's transparent to them that there may be parts of the 360 that will inform your decision making on the evaluation. So as long as that's established up front, you should, not have any problem using that feedback.
Okay, so I'm just wondering, because I do think that the wording of this is somewhat awkward, quite frankly, of this motion, but maybe it's just fine. But I'm wondering if there's a motion that says that we will have a separate, and I don't even know about this will not include, but a separate, reword this as a separate 360, formal 360 evaluation. And if we need in any way to go back and amend the motion that we took, bring that back up to say that we could inform the CEO and be using some of that, material, right? If we have an advance. Is that what I'm hearing?
Madam Chair, it to me means that if we're going to have a tool, then we would probably be best to use it. However, we as a board need to determine what kind of questions, what kind of information.
I understand that. We'll get to that once we decide. What we have to decide tonight, though, is whether it is a separate evaluation or part of the annual performance evaluation. Manager Bell, did you have something to add?
I don't know that I have anything to add. I'm just trying to help clarify it. I see them as two different processes. I see the 360 as a process, and it has its own sort of frequency. I see the evaluation tool as a process with its own frequency. Now, if the 360 is done in a timely manner, that it provides information that feeds into the yearly evaluation, I think Mrs. McNally is saying that we can use it.
Correct? Is that correct, Ms. McNally?
Yes, with the right expectations being set up front with the CEO.
And Ms. Willers, we could make sure that that is done, correct?
Yes.
Okay, so what I'm hearing is, yes, Manager Jones, did you have something?
I think Manager Bell indicated exactly the question. The caveat is timely. And the question is, I think I heard several individuals say we should do this maybe every 2 years, no more than 3. My question is, and my position is, I could compromise with that, but I still think it needs to be annual, because the 360 has impact that occurs more than just every 2 years. And I think to have that as a tool to give feedback is important.
But Ms. McNally has stated to us that best practice is in fact not to do it annually, to have the 360, the separate evaluation, to then give a year to see if the CEO incorporates it, and then to do it again. That is what Ms. McNally just told us is a best practice.
I heard that, and I hear what she was saying, but I'm also saying our unique position.
Okay, I understand.
Makes it different.
Okay, members, are we ready is there further discussion, or are we ready to vote on this motion? Yes,
Manager Greenberg, if I may,
Yes.
I think that I apologize, the wording of this motion might have gotten a little bit, it might have caused a little bit of the problem.
As I said, I think it's a little awkward, the wording.
The use of the word results, it was not kind of what the meaning was. I believe that the meaning was that the entire 360 would not become part of the evaluation.
So can we reword this to say that we are doing a 360 evaluation that is a separate process or something like that? Because yes, I think that this wording is not quite what we're looking for.
I think if you just left out the word results the first time it's used, and then at the end of it said, however, the results of the 360-degree evaluation may be used in other applicable portions of the CEO's evaluation.
Okay, can you read to me exactly what you're stating? I'm sorry, but not having you in person is a little difficult.
If you're ready.
Yes.
I
yes,
move
sir.
that the president and CEO receive a 360-degree evaluation with the participation by staff, management, and stakeholders of the Central Health Enterprise, and that the 360-degree evaluation will not become part of the CEO's formal evaluation. However, any results from the 360-degree evaluation can be used as applicable on other portions of the evaluation.
How does that sound, members? To me, that sounds much more like what we are saying and envisioning. So is there someone who wants to make that motion as was just stated? And if Mr. Duncan, if you can type that out for the record.
I have it. The very last word, however, any results from 360 can be applicable to the evaluation. Is that what we said?
Used as applicable on the evaluation.
Okay. I have. Okay. So do I need to withdraw my first one and then do this, this one?
Yes.
Yes, that would be ideal. And if you'd like, I will tell you, for many years I have used this practice. You are certainly welcome to say so moved, because I have already read it for the record.
Yes, that's what I was thinking you could do. Okay, so move. So Manager Zuniga has moved. She withdrew her motion. She has moved the motion. Manager Bell has seconded. Do we need any further discussion, members?
I just want to go on record as saying that we're not going to incorporate this on an annual basis. And I believe it should be somehow, the impact and the information should be incorporated in the annual evaluation.
Okay, thank you.
And I just want to note that for the public record that this board decided not to do that.
I understand what you're saying. I do also want to note that we had our consultant here who recommended it as a best practice that this be every 2 years. So both are noted in the record. Anything else? Okay. If not, then let's go ahead and take a vote. All in favor in the motion before, say aye.
Aye.
Aye. Any opposed, same sign. One no. Any abstaining?
I'm going to abstain.
Okay, so, all right. So we have Manager Jones, no, and Manager Valadez abstaining. All right, thank you, members. And we will work with Ms. Willers and the consultant will be back before us, because as Manager Jones and Manager Valadez just pointed out, it's very important that we have the right people and questions included and entities included in this. So thank you all for this very thoughtful conversation. Appreciate it.
Thank you, Ms. Greenberg. Thank you, Forrest.
Thank you.
Thank you,
All right, thank you, members. We will now move to item number 5, receive and take appropriate action on a presentation from Cool River Consulting regarding Central Health's compensation philosophy. Susan Willers and Michael Hanna will be presenting.
Yes. Good evening again. Thank you. We are actually, Brianna, you're going to share the screen, right?
Yes, I see it. Maybe we could enlarge that.
Okay. In the August board meeting, Mr. Hanna presented the results of the survey and engaged in a robust conversation with you all regarding the priorities and possible revisions to the Central Health compensation philosophy. Mr. Hanna is here tonight to help review the recommended revisions and discuss a few key items. And with that, I'll turn it over to Mr. Hanna.
Thank you so much.
Thank you, Susan and Madam Chair and evening Board of Managers. Appreciate you all meeting again with me this evening. For those of you that weren't in the session back in August, I am Michael Hanna, owner of Cool River Consulting, a compensation consulting firm based here in Austin, Texas. And what we wanted to share with you this evening is the refined, revised compensation philosophy document. What we're presenting here is based off of the feedback that we received, as Susan mentioned, from the survey that we conducted back in July, August to the board members, and then the follow-up conversation we had with the board during that session in the middle of August. So what I'd like to do this evening is share with you the updated compensation philosophy document to test it with you, validate what's reflected here, and ultimately gain your approval on the revised compensation philosophy for the organization going forward here. We did do a fair, substantial amount of revisions from the 2007 document. We did provide Susan with a redlined, updated version, but felt that it would probably be best to walk you through this cleaner version and get your reactions and feedback as we move forward here. So this first page basically is just a quick introduction to the document itself. That first paragraph is pretty much what was in the previous document. The amended document methodology actually walks through the process that we used this year in gathering you all's input, testing some of the philosophies and approaches to how we want to design and define this compensation philosophy for the organization. Keep in mind, this is a kind of a high-level overview of what you value as an organization and how you want to recognize and reward your employees within the organization. It is not meant to get overly detailed on any particular compensation program or employee population, but truly to kind of give the blueprint for helping the organization make decisions on how you want to design your programs and administer compensation on a go-forward basis. So from kind of the walking through the methodology we used in gathering feedback from this group, we start with a very high level. What is the comp philosophy objectives of the organization? What are we trying to achieve with this? And you'll see that at the bottom here regarding what the key objectives are. Primarily, we want to support and align the mission, purpose, and values of the organization. Also linked to the Central Health's enterprise-wide strategic plan. Promoting an inclusive and diverse talent environment is extremely important. That is something that came up quite a bit in the survey that we conducted with the group, as well as the conversation that we had during the session in August. So you'll see some of these values and viewpoints kind of woven in throughout the entire document. Also having a balanced view regarding driving internal equity and fairness within the organization and in the compensation decisions you're making, as well as differentiating individual performance where it's warranted. Some of the high-level guiding principles here for your compensation program on page 2, we want to make sure that we're promoting fiscal discipline and responsibility, but also ensuring that what you develop and the programs that you have, support and achieve the overall strategy and goals of the company or the organization, and ensuring that you do get the right talent where you need it. So and with most organizations, this is a balancing act and in the decision-making process of ensuring that you are fiscally responsible, but also ensuring that you're getting the right talent where you need it within the organization. Some of the key principles related to the compensation programs and your overarching compensation philosophy, tying them directly to, again, achieving your key strategies and organizational performance goals. Achieving your top 3 key talent objectives, which were the 3 that were identified by the board members during that survey in terms of meeting diversity and inclusion goals, and then finding and retaining qualified and key talent within the organization. And then lastly, also, and don't want to lose sight of this, promoting the desired cultural values within the organization regarding collaboration, an empowered workforce, promoting innovation, thinking outside the box, and really, having people accountable for the results that they're trying to achieve within the role that they're in. In terms of what key things that you want, 3 things you want to ensure you reward within your compensation programs: ultimately, overall enterprise performance, individual performance, and then individual skill development. And that was those were, again, 3 things that were predominantly set as the 3 most critical call outs through that survey. Now, when we talk about the individual skill development, I want to make sure that as we talk about that, give a little bit of context, that it's not just kind of getting any kind of skills or certifications, but it's something that's truly relevant to the role that you're in, and enhancing your career, or as well as supporting and providing additional deliverables and results to the organization as a whole. Getting more specifically into the compensation philosophy, here are some of the key elements and things that I want to make sure I test with the group here, that you all agree that this makes sense for the organization as a whole. In terms of defining your talent market, it's difficult based on the variability in the types of roles that you have. So you want to make sure that you tailor who you compete with for talent to that particular role. And we have a table in the next page that kind of starts speaking more specifically to the different types of roles and how you want to compare yourself to the external marketplace. Again, also ensuring balancing internal equity and how you pay individuals with what the external market pay is for those particular roles as well. Overall, the target would be 50th percentile of the market from a compensation-based salary perspective, and ensuring that you're keeping up to date on what that 50th percentile market looks like for the organization, and that it's not something that reflects 3 or 4 years ago in terms of what the median from the market is for those particular roles. There was a bit of conversation regarding identifying specific roles where there may be a shortage of talent in the market, to potentially position that salary target a little bit higher than the rest of the organization. And so sharing some examples here, I think that's something that you don't want to just set in concrete right now, but it's something that you'd want to take a look at on a fairly regular basis, whether it's annual or every 2 years, in terms of what jobs potentially might fall in that higher percentile target market. Also, regarding having the opportunity or the ability to provide spot recognition awards to individuals that go above and beyond within their role. So if there's individuals that take on additional responsibility without being asked to do so, putting in the extra hours, extra effort to achieve some specific project deadline or timetable or result, having the capability and the ability to to identify and reward and recognize somebody for that above and beyond performance. Again, this would be something that, you know, you as an organization would need to define what that looks like specifically and what kind of recognition would be appropriate for that, for those results. The table here drills into kind of just providing a very high level overview specifically on how you want to position your compensation for these different types of roles within the organization. So again, for most of them, 50th percentile, direct patient care, or for roles where it's hard to find appropriate talent, or there's a limited availability of talent for that particular role. You know, those are ones where you might flag it at a higher percentile from a market perspective. The equal opportunity employer section here was pretty much just lifted and shifted from the prior document. So we did not make any substantial changes to this. This is what was reflected in the prior compensation philosophy. So we can continue on here. The employee value proposition, this is something that a lot of organizations like to communicate and represent to potential new hires or even your current employee population in terms of, you know, what we value and recognize and reward for as an organization. So again, you know, diversity, equity, and inclusion is a key value that we want to ensure our compensation practices support and promote within the organization. You know, ensuring that they adhere and support our core values. You know, that we continue to recognize and have a collaborative environment within the organization, and then also ensuring that, you know, we recognize and reward people that seek to learn, grow their skills, capabilities, and grow their career within the organization. Ensure that they, you know, can contribute as much as possible and enhance that contribution, you know, over the years. There are various data sources that Central Health uses for assessing and looking at the external market in terms of what is competitive pay. Society of Human Resources Management Healthcare Survey that's conducted annually, the Warren Report, the Connexa, and then the Comp Data database are the various sources used, as well as the Economic Research Institute, the ERA database. All very well-known, respected data sources that a lot of organizations out in the marketplace utilize. Regarding performance evaluations, these definitely would be taken into consideration when making salary decisions annually, not just in terms of the individual's results based on the role's expectations and their annual performance goals for that year, but also looking at, you know, where their current pay falls within the pay range for their particular job. Those two elements would be taken into account for determining what is the right salary increase for that individual for any given year. So if it's somebody that's a top performer and they're currently, you know, low in the pay range for their role, they may have a slightly higher salary increase than somebody that's higher in the range and a solid performer, but not, you know, a rock star, so to speak. So that those are, you know, two elements that would continue to be looked at when making decisions from a compensation perspective annually. And then lastly, the last section here regarding the president and CEO compensation, the board of managers would continue to be responsible for managing the hiring and the performance monitoring of the president and CEO on an ongoing basis. So that section has remained from the prior document as well. And then I think the next section's basically the more the redlining in terms of what was changed from the 2000 version of the document.
Thank you so much.
No, thank you very much. Any questions or call outs that or items that you would like to revisit that was presented within the updated compensation philosophy?
Managers, please wave or shout out if I'm not seeing you. Any questions or anything you need elaboration on or comments? It was very thorough, and I appreciate all of your work. Managers?
And Susan, if there was any conversation we had that I didn't elaborate on or touch on that you think we need to ensure we share with them here, definitely feel free to voice it.
Susan, anything you would like to add?
No, I think you covered it all. Thank you.
Chair, do you need a motion?
Yes, sir. Need a motion if there's no discussion, and I'm not seeing or hearing any, so we'll move to a motion.
I move that the board approve the recommended revisions to the Central Health Compensation Philosophy.
There's a motion. Is there a second?
I'll second.
Okay, there's a motion by Manager Bell. I think that was Manager Musaitif, right? With a second, correct? Any discussion, managers? I'm looking, and if I miss you, just please shout out.
Just one quick question.
Manager Valdez.
With respect to workforce numbers and whether or not they reflect or are moving in the direction of reflecting our targeted population, or the population that we were created to serve, how would that be addressed? That's going to be, I guess, incumbent upon this plan. I mean, that would take care of that, or is there something different that needs to be added?
Ms. Willers?
I don't think I understand the question. I'm sorry.
The question is whether or not our workforce reflects the population that we serve. Very simply.
Yeah, so next month, you all will get the actual workforce demographic report along with the compensation piece that we do on an annual basis. So that's coming next month in November.
Thank you. All right, there's been a motion.
One follow-up then. So
yes.
That means that next month when we get that information, this is going to be a living document, so we'll be able to amend it as necessary to make sure that we're moving in the right direction. Is that correct?
Yes, this can be updated as hopefully we'll be updating this every other year since we hadn't done it since 2007.
Okay.
Yes, that is too long. We certainly shouldn't be waiting that amount of time. It sounds like a 2-year cycle is a good suggestion. Thank you.
That was why it was important to me to make sure that we were moving in the right direction to appropriately and reflect our demographics. That's all.
Thank you so much. Appreciate that very important notion, and also Ms. Willers, the moving to a biannual, as we would say, on this. All right. Any other discussion? I'm not seeing or hearing any. So everyone, if you're in favor, please note by saying aye. Aye.
Aye.
Opposed, same sign. Any abstaining? Thank you, members, and thank you to our presenters. Very thorough. We appreciate the work.
Thank you very much. Appreciate it. Thank you, Susan.
Okay, members. We have our next item is agenda item 11. Consider and take appropriate action to authorize the Central Health President and CEO or other duly authorized board members or personnel during the pendency of any applicable COVID emergency order affecting operations of Central Health or until June 1, 2021, whichever is first, to settle any liability claims, lawsuits, or similar matters after consultation with the board chair and vice chair. And also item number 12, receive briefing from outside counsel and take appropriate action on EEOC charge number 451-2020-01440, Wallace, petitioner, v. Central Health, respondent. Managers, I announce the board is convening in closed session to discuss agenda items 11 and 12 under Texas Government Code Section 551.071, consultation with attorney. So let's take a 5-minute break. I understand. Is 5 minutes enough, members, or do we need longer?
It's fine.
Okay, let's take a 5-minute break, and everyone needs to get off of this particular video conference, and in 5 minutes I will meet you on the video conference that you have received for the closed session. Thank you. Okay, do we have all of our members present?
You do have a form, but I don't think you have everyone back. Oh, Dr. Bell.
Okay.
3, 4, 5, 6.
Okay, just let me know when we have everybody back.
I believe managers. Oh, there's managers union. I apologize. I missed managers union. Yes, ma'am. We're all back.
Okay. Okay, so we're all back, and it is October 28th at 9:10. We have completed our closed session, members, and we are back in open session. We have before us agenda items 11 and 12. Do I need to read those again, David? You're on mute, David.
Yes, ma'am, if you would.
Yes, that's what I thought. So we are back in open session, and the items that we had before us are 11. Consider and take appropriate action to authorize the Central Health President and CEO or other duly authorized board members or personnel during the pendency of any applicable COVID emergency order affecting operations of Central Health or until June 1st, 2021, whichever is first, to settle any liability claims, lawsuits, or similar matters after consultation with the board chair and vice chair. And we also had before us item number 12, receive briefing from outside counsel and take appropriate action on EEOC charge number 451-202-01440, Wallace, petitioner v. Central Health, respondent. Members, are there any items to take up?
I'd like to make a motion.
Manager Valadez, okay, you're recognized, yes.
I move that the board authorize the chair, the vice chair, and Ms. Willers to continue settlement discussions with Mr. Wallace and return to the board for approval on any negotiated resolution of claims.
Okay, we have a motion. Is there a second?
I second.
We have a motion by Manager Valadez and a second by Manager Zuniga. Managers, is there any discussion? I'm looking. I'm not seeing any. Raise your hand, shout out. I'll give you a second. If not, then we will proceed to a vote on this motion, which has had a second. Okay, I'm not seeing any members who desire to discuss this or ask any questions. So we've had a motion and a second. We will move to a vote. All in favor, signify by saying aye.
Aye.
Aye. Opposed, same. Do we have any in opposition? I'm not seeing any in opposition. Do we have any members who are abstaining?
I am.
Okay, so we have 2 abstaining. I see Manager Jones and Manager Musaita. Okay, thank you, members. We will continue with our agenda. We will not be taking up agenda item number 6 tonight. We will come back to that in our November meeting. Is that correct, Mr. Giesland? Yes. Okay, so we will come back to, we will not be taking up agenda item number 6. We will move now to agenda item number 7. Receive a briefing and discuss fiscal year FY 2021 strategic objectives for board adopted budget resolution or board directive, and receive updates on specific items, including A, workforce recruiting and leadership pathway strategies, B, adverse impact studies relates to a potential affirmative action plan, C, hub vendor work plan, and D, hub vendor contracting data. Mr. Giesland will start, and presentations will be made by Susan Willers, Betsy Good, Sherelle Freeman, and Lisa Owens. Mr. Giesland? You're on mute. Mike, we can't hear you.
I need to be unmuted by the host.
Well, we can hear you now.
Okay.
Now you're good.
Yeah. Okay.
All right. Thank you. So I apologize. My computer shut down, so I had to log back on. So thank you for the brief absence there. So, and I did not hear, did you officially bring up agenda item number 7?
I brought up agenda item number 7. I said agenda item number 6 was being postponed until November meeting, and we're now on agenda item 7.
Yes, thank you. So Brianna, if you'll go ahead and share the screen. Thank you. So first, as a preamble to this, and actually if you could back up to the cover memo for this agenda item, thank you very much. So as a preamble to this, there's a memo that's in your packet, and I'll go over an illustration slide, and then I'll turn it over to Susan Willers and Lisa, and each of them have staff and team members that they're going to be bringing into this presentation tonight. But first, as a preface to this, let me just say, Chair Greenberg, to look at the comments that you made earlier this evening. When we talk about cultural issues, certainly we've talked about reintroducing a values statement, and this pertains to a lot of our cultural issues that we're talking about this evening in the agenda. That statement was well received by the Equity Inclusion Task Force, and we look forward to coming back and discussing this with the board. But I think a companion to that right by all statement is acknowledgement and making amends. And I join you in acknowledging that we can have better conduct, not just in the board meetings, but throughout the organization in terms of our meetings, and certainly want to apologize to those that have been disrespected. Whether we're talking about some conversations that happened with Ms. Greer, Dr. Mullen, other board members even, and staff as well. And so we very much appreciate the opportunity and the space to have those moments where we can reflect and make amends and move forward, and being more mindful in how we can be right by all. And so thank you very much for making those statements earlier.
And thank you.
So on this memo right here, we outline what the strategic objectives are as adopted by the board in the fiscal year 21 budget resolution. And you see those as the bulleted items there. And if you'll scroll to the next page, please. Really what I just want to put in front of you is just for your awareness is similar to what the template will look like. I know we've reported to you in memo fashion before, but we'll either put together a template or some type of list that you see there. Would appreciate some feedback from the board, at the appropriate time. But the more important thing, or two important things, is that we're going to be coming back to the board in November and December as we work through staging on these strategic objectives and reporting on what success looks like at the end of the fiscal year, but also what some of the key milestones will be, so that you can expect, as can the public, what the reporting will look like, and the types of status reports that we'll provide, so that you can track what's happening. And this is important not only for transparency purposes, but also make sure that we're fulfilling our mission and complying with the strategic objectives set by the board. Now, from time to time, we will have very detailed focus reports and other support schedules. And there's just some samples here, but they're certainly not exhaustive. But two tonight that you'll hear about are our workforce assessments and diversity and our recruitment, retention, and leadership pathways, specifically an affirmative action study that was performed on recent manager and executive level hires. And then second, you'll hear about the work related to improving upon our work and our relationships with the historically underutilized businesses, including entering into a disparity study, which was in the consent agenda, that will help us identify more opportunities that we can do to improve. So if you'll scroll to the next slide. So before I hand it over to Susan, I wanted to put, it seems like that the hub and the disparity study work is fairly self-explanatory, but with some of the cultural issues around workforce, it bears some more explanation about how all this fits together. So if you think about our organizational culture, and who we are and what we aspire to be, what we need to be good public servants, there's some things that we need to do with our own workforce. One is recruiting and retention and leadership pathways, which you'll hear more about. And this is retention and diversity at all levels as well. And then there's employee engagement and employee-led activity. And so this is in part, and just one example, equity and inclusivity task force that is focused on values and objectives. And two of those subcommittees have reported in the next, and now we're working on, or they're working on next steps, and look forward to discussing that more. But the employee engagement, employee-led piece of our culture really is a source of energy. It's a source of ideas. It's a source of leadership, and it's involving many employees from different walks of life, very diverse group, and not just one or two people that are focused on this. And so it's really about organizational-wide effort and endeavor. And then moving around this circle as a key component to culture is training. And training can take many forms. It can be online, it can be, or virtual rather, in this environment that we're in person. Personally, my preference is in person, but I understand in a pandemic that makes it difficult. So we're going to have to make some adjustments there, but really focusing on disparities, racism, and equity as we think about, how it is that we inform ourselves so that, again, outwardly we can be better public servants and delivering healthcare to those that need it most and fulfilling our mission. So that's just some big picture context, if you will, about how the retention and the recruitment and the leadership pathways, employee engagement, and the training all fit together. And tonight you're going to hear about, from Susan on the recruiting and retention and affirmative action study that was done. So with that, I will hand it over to Susan and her team.
Thank you. As Mr. Giesland mentioned, Central Health has been working on a study to determine if any relationship exists between the selection decision of management positions and the membership to any racial and or ethnic group. I am now going to turn it over to Betsy Good. You all have heard from her before. She's actually the author of this study. And with that, I'll turn it over to Betsy. Betsy?
Thank you, Susan. Yes, my name is Betsy Good. I am the HR Information Systems and Compensation Analyst for the enterprise. It's very good to see all of you again and to be in front of you again this evening. I know it's late, so I will do my best to get through this quickly, yet cover it as well as possible. So jumping right in. As Ms. Willers described, Central Health has examined management level hiring decisions covering a 2-year span in an effort to determine the existence of adverse impact and therefore whether there is a basis for our organization to move forward with a voluntary affirmative action plan. And here is the technical definition of adverse impact, but it may be more easily thought of as unintentional discrimination within an organization. There's also a term called disparate treatment, which can conversely be described as intentional discrimination, which we won't be talking about today. Here, the uniform guidelines discuss that they were developed as a way to standardize how adverse impact is determined and to provide a framework for employers to properly use selection tests and procedures. And while we are not required to follow these guidelines, we chose to hold our organization to the same standard as is required for organizations that contract with the federal government. So, moving on to a brief discussion about the Supreme Court and the EEOC. The standard set by the Supreme Court and subsequently adopted by the EEOC regarding voluntary plans states that the intent of their use must be as a temporary method to correct findings of racial imbalance and not used as a method to maintain current balance within an organization. This information is found on the EEOC's own website and is stated to refer specifically to the Supreme Court case of United States Steelworkers versus Weber. And the EEOC has outlined several process steps which need to be followed prior to creating a voluntary plan, and we'll just go through those quickly in summary. So we would need to find that adverse impact exists. We would need that finding. Then we would need to analyze each step of the selection process from, say, recruitment to the final interview. And lastly, we would need to show that the step where adverse impact had been found to occur, for example, say a selection test, cannot be scientifically validated. If a selection measure or process can't be validated as a predictor of selecting successful candidates, a voluntary plan may be considered a lawful remedy to the adverse impact found within that particular process due to its invalid use. So moving on to the data very quickly, this slide discusses how through the use of the uniform guidelines, certain data were selected to be excluded or characterized if it were included. We'll now quickly move on to the next slide. Oops, got ahead of myself there. Here we really want you to focus on the 587 applicants and the 28 selection decisions, which are the hires and promotions, as those 28 decisions are in effect our sample size. So let's go ahead and move on to the next slide, which shows our raw data represented in comparative charts. So here we have the 587 applicants dispersed among each of the different racial ethnic groups. And here are the selection decisions that were made, again, dispersed among the different racial ethnic groups. And lastly, what we have here are the hires that were made relative to the size of the applicant pool. So before I compare these charts, I'd like to say that, while we are admittedly looking at very different numbers across these three charts, of import was to ensure that the y-axis was accurately representing the highest values as equally tall bars. So we would be looking at a representation of essentially equal proportions. This allows us to more easily compare how the charts change from left to right. For example, the white race had 334 applicants, 13 hiring decisions, yet 4% were selected out of the 334 applicants. So 13% out of 334 is 4. To continue on, the Hispanic and Latino population had 93 applicants. 8 of those were hired, and that equated to 9% of the applicant pool that were selected. And on we could go through the rest of the racial groups and look at those patterns. But let's move on and look at the Travis County population and the Austin population, which, as you can see, is as has been in the past, very, very similar, differing only by 1%, I think, in 2 different groups. In contrast to that is the pie chart here, which shows the relative proportion of hires and promotions over the entire selection decisions. So all 28 selection decisions are included in this pie chart, of course. So let's look at the Hispanic Latino population here as well. They're all actually pretty equal. pretty equally dispersed. So equal in the population and represent equal proportion of hires. Conversely, we can look at the white race regarding the population of Austin and Travis County, which is roughly 50%. However, they make up only 15% of the total hiring decisions made. So you can see that each slice of this pie is quite different, again, besides the Hispanic Latino population. Now let's look at the population served demographics. I understand that you have seen this data before via JP, Eichmiller, and others, but we included it within this chart as we are aware that there have been previous requests to see this data included, and understand that you will be seeing it represented more often by us apparently in the very near future, if I heard earlier correctly. Let's talk now, if we may, about the method used. So this first bullet gives a bit of background on what can be considered the enforcement arm of Executive Order 11246. That executive order requires affirmative action plans for organizations that contract with the government. Now, they, being the OFCCP, will look for adverse impact among those organizations and use two distinct tests to determine its presence: the chi-square, which is proven to be highly unreliable with small sample sizes, and Fisher's exact test, which is considered the best test for this type of data when sample sizes are less than 30. Besides being the most accurate test and the one the OFCCP themselves would use, FET also has an additional advantage of providing exact probabilities. This will be discussed in further detail in the next slide, but to help define what Fisher's exact test is, in a sense, and kind of what it does, it essentially examines the significance of a relationship between two classifications. Those classifications here are race and ethnicity and the hiring decision, yay versus nay. So it tests the probability that the actual results were significantly different than what the model would predict from the applicant pool size versus the amount of selection decisions that are in the sample size itself. So moving on, this portion discusses regression and its increasing use in Title VII cases. And to really kind of sum up regression, it can be described as a powerful statistical technique that, if significant, could actually use race or ethnicity to predict hiring decisions. So in other words, being of a particular race or ethnicity would be able to significantly determine whether or not you as an applicant were hired, which is why it is considered so powerful, among other reasons. So moving on to the results. This chart represents the difference between the number of people actually hired versus the number of applicants predicted to be hired. So yet another benefit of Fisher's exact test is that it gives a theoretical model of, in this case, hiring decisions based on the size of each racial, ethnic group's applicant pool. So let's examine. So for the white racial group, there were 3 less hires than the model would have predicted, or the model did predict. Additionally, there were the Hispanic Latino population had 4 additional hires than the model predicted. And the Black African American racial group, as well as the 2 or more races group, both had no difference in what actually occurred relative to what the model predicted would occur based on the sample sizes, which speaks a lot. And to kind of sum up the results, the test proved that a relationship between race and ethnicity and hiring decision does not exist, and to say that a relationship did exist would be incorrect up to 91% of the time due to certain p-values that were examined and so on. So to continue with the results, we will quickly go through this as you're aware of most of it by now. The 2 tests used were Fisher's exact test and regression analysis. And as just discussed, FET did not show a significant relationship between the two variables, and those are hiring decisions and membership to any particular racial or ethnic group. As far as regression goes, for this analysis, the p-value, or the probability of falsely rejecting the null hypothesis, was 43%. So to put it in other words, random chance would do just about as good of a job at correctly determining the outcome of a selection decision based on someone's race or ethnicity than a regression equation would. In other words, the equation results show no relationship and cannot explain nor predict outcomes in a significant fashion based on selection decisions and an applicant's race or ethnicity. Oop, boy, jumping ahead of myself here. There we go. Okay, so to quickly sum up this analysis, regarding voluntary affirmative action plans, we have shown tonight that they must be a temporary measure used to eliminate a racial imbalance. As mentioned earlier and stated here for the sake of simplicity, there must be a wrong that the voluntary plan would be devised to right, along with the time frame for this to occur. Though just because the results of this study were unable to show any relationship between race and ethnicity and hiring decisions, that does not mean any decrease or elimination of efforts to attract and retain a more diverse workforce should be affected in any way. It absolutely should not. In fact, there are other steps we are currently taking to promote equality and diversity among Central Health's applicants and employees, as increasing diversity in every sense is of the utmost importance to this organization, as will be evidenced by the discussion immediately following this now concluded presentation. So once I get through the references and my bio, which we'll skip, I will turn it directly back over to Susan. Susan?
Thank you, Betsy. Thank you.
Certainly.
So the idea behind our commitment to diversity and inclusion is about providing a culture in which we embrace as a company diversity and inclusivity in our jobs, in our hiring practices, and throughout an employee's life cycle, including how we do business. Mr. Giesland has previously briefed the board, and in fact, he just briefed you all this evening on the Equity and Inclusion Task Force. In July of 2020, that task force split into 3 subcommittees, and each of the committees had very specific work that they needed to complete. And so a couple of weeks ago, they presented their final work, which was incredible. And we're really excited to share it with you all in the near future. But it focused on a purpose. We actually built the foundation so that it is sustainable throughout our culture. So there is a purpose, a vision, there's value statements. We created overarching goals and created a employee resource group. The committees have finalized all of these important phases, and we're regrouping in a week and a half. They're going to start working on setting the tactics on these goals. And so they're really going to operationalize our diversity and inclusion plan. The task force will also be working on a training plan that Mr. Giesland alluded to on in-depth training on identifying and addressing racial disparities and health inequities in our daily work. We also have our recruitment team working on expanding our outreach efforts to increase diversity of our applicant pool by partnering with Texas colleges and universities, including those schools that have identified of having a diverse population. And we've connected with LinkedIn sources that reach individuals of diverse and traditionally unrepresented candidate groups. With Betsy's help, we were able to create a new exit interview tool that we began using October 1st. And so hopefully within 6 months, we'll be able to report back to the board during our normal demographic reports on turnover. But some of the key measures that we will be taking from this tool is equitable treatment of staff, how they feel, staff's opinion on diversity and inclusion efforts, and management's conduct and ethical behavior. So we're really excited about this. I really do commend the staff that have been working on these efforts. They have worked tirelessly for several months now, meeting week after week. And so as we continue, there's more to come, but I wanted to give you just a brief description of some of these efforts. And so with that, Betsy and I will turn it over to you all for questions.
Thank you so much. And I know that there are many, many staff members working on this the work is just incredible. And I know that this is additional work. And I know that they're not all here with us on this video conference tonight. So I want to extend my deep gratitude and appreciation for the amazing work that they have done, are doing, and will continue to do. And if you would please let all of them know that, please.
Absolutely. Thank you.
Thank you. And thank you, Betsy, for that fabulous presentation. Thank you, Susan. Mr. Giesland, did you have anything that you wanted to add at this point?
No, not at this time. And just to remind the board, we do have another presentation from Lisa and Belina on the hub work that we're doing.
So should we take questions now or continue with those presentations, Mike?
If we could, I'd like to continue with the presentations, and then we can circle back, because this is a lot of information. We know people may need time to form questions.
Okay. All right, so let's continue then. Who's next?
Hi,
Lisa.
it's Lisa.
Thank you,
Owen.
Lisa.
Good evening. And I going to talk to you a little bit about the hub work plan, extensive backup. At this point, though, I'm going to try to just hit some highlights. Let me go ahead and share my screen. Oh, Betsy, can you stop sharing? Thank you. I'll just hit some highlights. I think the first thing in our hub work plan that we shared with you earlier this year was a lot of foundational work that, hoping you can see that. A lot of foundational work that needed to be done, thank you, in order to start this work. And I'm very excited to introduce you to our new team. Our new procurement manager, Belina Bunch, has joined us. However, at this late hour, I did let her know that I will do that at our next meeting, and I will do it first. So we'll be back for introductions. We also have another position that we just filled this week, as well as additional investments through the business case process in contracts management software and some additional software that we've talked about in the past that we think will really give us the ability to collect better data on an ongoing basis instead of just once a year going back and collecting this data. So that foundational work, I want to assure you, is underway, and we have a great team as well working on all of this. The other thing that we have worked a great deal on, I think as I switch to this work plan, is some interdepartmental collaborative planning. So a few updates on our hub work plan about outreach. One of the big areas where we have a potential for more hub participation and subcontracting, as most of you know, is in construction. So we have started planning for the extensive construction efforts that are coming our way. And as the Eastern Travis County Subcommittee approves those discrete projects, we will be hosting specific construction hub informational sessions about how people can get involved, the type of events. That item here is referred to as hosting specific events, high participation opportunities. And so we've already started planning for that in order to make sure people know about how they can do business with Central Health on the specific projects that are coming together in clinic development and construction area. And that's not the only space. We also are working on how we can do more awareness through social media and general outreach as any solicitation is posted. In addition to just the foundational work that I talked about, you will see that in our a slide I prepared for you in the backup, that in our just solicitations in general, as well, with the impact of COVID, we have been focused on making sure that we support our partners and the community to respond to the pandemic. And so we have not, and I think you may recall from last year, we in the past few years have had anywhere from 14 to 16 formal solicitations. So in FY20, we did have 11. And you'll see that in the notes here, 6 are still active. So we had a little bit of a lag in that we did not have a lot of formal solicitations as we were transitioning to remote work, responding to the COVID pandemic, but we are fully functional, working remotely, and have picked up a lot more formal solicitations recently, and many of those are still active. I was able to pull some data and again, just report out on how many people are we getting the message out to, and that's what you'll see in these first few highlights. So for those 11 requests for proposals, I provided some data around how many people are getting notified and what percentage of those are hub or small businesses, how many are actually looking at it through our BidSync portal, and then how many proposals are we receiving. So you'll see that of the 80 proposals submitted for 11 RFPs, we did have about 32% hub or subcontractor hub, meaning that they would have proposed in their proposal to include subcontractors in their scope of work and the proposal that they're responding to. We had one construction project that we had. We had a small project in Hornsby Bend, you'll remember last year, as well as 4 solicitations that were either professional or consulting services, another area that has opportunities, 1 software with implementation services, and then employee benefit plans. So of those 5 contracts awarded, 3 of them did have hub subcontracting opportunities. So we are having quite a few subcontractor activities in our 3 contracts of those 5 that were awarded. And again, I know these are smaller numbers, and you'll see at our partners at the city or the county. However, I will say that we are really looking forward to the last big effort that has been underway since I last presented, which is reaching out and securing a scope of work so that we can contract with Collette Holt and Associates. And that disparity study, not only will we have great information at the end of it, but I believe along the way, the process will be supporting our work plan for improving our outreach and improving our collaboration with the city and the county, who are great partners and will be also using the same vendor to undertake their disparity study. So just a couple highlights on the disparity study. We appreciate, and the consent agenda, there was approval to move forward with that contract. We have asked as part of that the vendor, Collette Holt and Associates, present to the board. So as soon as that contract is executed, I would hope that that presentation could happen to the board, where they can outline for you exactly what the study will entail and what the project will look like over 12 months. There is extensive opportunity for people to give input through a website and a secure email that goes directly to the vendor. And a lot of collaborative work, again, with Collette Holt and Associates also doing the disparity study for the city and the county. A lot of that economic data and business data applies to all of us in the Austin MSA and the Travis County area. So the next step on that is, as we get the contract executed, we will coordinate a presentation to the board from them about their work plan, all the steps and milestones in that work plan, any questions that you might have. And then again, at the end of the project, they'll come back and report out to the board directly about what the study has found and the recommendations. So I would just encourage you to look at the work plan details. I tried to provide a lot of details on every item in the work plan as to where we are. And I'm happy to answer any questions as I'm going to turn it back over to Mike, or I can answer questions, or Manager Greenberg.
Thank you so much. I believe we have, if everybody can turn off their mics, I believe we have one more presentation. Is that right, Mike?
No, I'm sorry. That concludes our focus reports for this item right here. Just these 2 reports.
Okay, just the 2. All right. So at this point then, managers, let's see if we can get back to our discussion. And I can only see managers really one at a time right now.
It may help if you stop sharing. There you go. Thank you.
There we go. Thank you. Thank you. Much better. Managers, so we'll open it up to questions or and discussion at this time. I'm looking to see any questions, managers. I know it was a lot, but Lisa, thank you for the hours and hours of work that you put into this, and it's exciting to see the additional staff and all of the efforts, and we look forward to getting that disparity study underway. So thank you for your hard work and all the work of the staff who are working with you. Members, any questions? Yes, Manager Jones.
Thanks very much for the presentation. It was very detailed, very informative, very helpful. I just have a couple of questions. I don't know if you can pull it up now or if you could just tell me. At our executive level, can you, as I recall our last presentation, there were no African Americans in the executive or director levels of the of Central Health. Is that still the case? Or have we been able to do some diversifying in that area?
No, sir, that is not the case. Over the course of the summer, there were 3 hires, one at the executive level, one at the manager, and one at the supervisor level.
Well, we indicated that in the profile of a few months ago, the report had director's level. So is that a different level than supervisor or manager, or does that level exist at all?
So in August, Manager Jones, we shared a graph showing the how those numbers had changed. And so, but we're bringing those numbers back next month because it closes out the quarter. And so we'll be back next month to show, our numbers.
Okay, I just want to make sure they're apples to apples as opposed to something else. So I can wait till next month, I guess, to find it out. I guess the other question I had was that you all did an excellent job, and I'll give it to you, in terms of practice, theory, research. But my question is, will we be here next year talking about the results of the study as opposed to actually having some improvement in the results?
Yes, sir. I'd embrace that question wholeheartedly, and that's the question and the motivator for us. We don't want to be back here talking about, wow, look at the results of that study, and is anything any different? We want that to be a very strong and self-evident answer. And so what you have, the commitment, it's not just from me, it's from throughout the organization, to not just look at these study numbers and go, oh, okay, there it is, as if it were a static number. It's a dynamic number, and it needs to change at the executive level, manager, director, but also in the way that we work internally. And this is something that I've stressed with the executive team, is as you're putting together your project teams to fulfill, our mission and what the board has set as strategic objectives, reach out to those even that are not at the executive level, to be more inclusive. And so it's not just, again, what's your position at the executive level? It's also, what are you included on, so that we can have diverse perspectives. And so, but coming back to the data that you just saw, If you think about on the workforce recruiting side, all the different activities that are happening to be able to improve upon the diversity of our applicant pool, to create leadership pathways. And, you know, even within the bounds of that, of the affirmative action study that you just saw, being very deliberate in everything that we're doing to promote and to hire and to be more diverse and inclusive, not only within African American and Latinos, but Asian, and it goes beyond race and ethnicity. That's obviously going to be a very, very deliberate effort. And my hope is, and Susan had a piece in there on the branding, is that as we're talking about ourselves as an employer, what's our employer brand? That people see us as a diverse and inclusive environment, a place where you can grow professionally, and not just hold a title with the word executive in it, but be very influential in terms of what happens in the community with respect to providing healthcare and fulfilling our mission. And so making sure that people see us for that. So Manager John, there's a lot of activity that's underway, and Lisa just highlighted, you know, she's got a very extensive work plan as well that she and Belina are working through. And so my hope is we come back next year and have a very different story through all the efforts that we're doing. And so that's why we're putting a lot of attention and time and effort into what you see here to be able to change that narrative.
Okay, yes. Well, thanks very much. My only comment is that the Austin way is to study things to death. And I just don't, yes. I would hope that next year we don't find ourselves asking this same question and getting the results of the study, but not actual action. So I'll take your word at that. We'll be looking for results. Thank you.
Well, Manager Jones, if I may, Madam Chair, may I ask a question?
Certainly, please.
Are you comfortable with, we'll need to come back and report regularly on what the numbers look like? And so I would ask that not be viewed as yet another study. It's really just being transparent and keeping the board aware. And so I would ask you to take that into consideration as we come back to the board periodically.
No, I would, and I'd appreciate that. But I do expect quarter after quarter to see some progress, and not just, well, we're still studying it and we'll get back to you by maybe 9 months and have some results. I would hope that we could make some little steps sooner than having to wait a year to get those results is where I'm heading.
Understood.
Yes, very, very important to see updates and progress. Absolutely. The implementation. Absolutely. Thank you. Members, anyone else?
I'd like to make a comment.
Yes, Manager Valdez.
Before I fall apart, my head's going to fall off. Thank you all very much, Lisa and Susan and Betsy, for the work that y'all are doing. I'm seeing, I truly believe that I'm seeing changes in the culture that is being created at Central Health, and I'm happy about that. With respect to the Equity Council that we just got briefly touched on, I wanted to make sure that the Equity Councils is going to be overseeing or monitoring or making recommendations for our systemic changes to Central Health's healthcare system, that it be reflective of our demographic. I think that's very important, because that lens has to be reflective so that it can be, I think, appropriate. I don't know if that makes any sense, but that's my suggestion. And with in addition to the training that you all talked about, which I think is great, a lot of that is lifelong experiences from people who live and who have those lived histories and those lived experiences for those disparities and systemic, I guess, exclusions, to put it a better way. And so I'm very glad that you all are looking at that. I would like to see maybe quarterly, if it's possible, depending on how many openings are available to Central Health. I know we're a relatively small organization, but if we're looking at this being enterprise-wide, it might be best to look at something other than annual with respect to the enterprise, so that we can see how that's working, especially in light of the fact of in light of the demographic population that we're serving. In addition, I'm hoping that they're also going to be taking into consideration the pools, the available pools that they be from, like, not only colleges, universities with their graduates, but also professional organizations that are minority organizations, and making sure that they are tied into our prospective lists for reach out and I guess networking purposes for possible employment. And I just wanted to say I thank you all for the work that you're doing. I'd like to be a part of this conversation, since I've been pushing for this forever. And I can see that only good things will come out of it. I can't believe we're going backwards. I do believe we are going forward, and with you all's help. Thank you very much.
Thank you, Manager
Yes.
Valadez.
And if I may, Madam Chair, just briefly,
Yes.
I'd like to recognize Susan. I think there's some discussion around leadership development that's pertinent to some of the questions that have been asked. And so if I can ask her to briefly cover that very quickly.
Yes, I apologize for not mentioning it earlier. In the memo that I provided on leadership development, we're really proud of the work with the Emerging Leader Program. I briefly told you all about that in the summer. We had our first graduating class in June, and we had 8 candidates that made it through, 8 ELP participants is what we call them. And what we're doing is we are setting up a pipeline of individuals, of staff level individuals, even at the supervisory level, we're getting them ready. It's a rigorous 6-month course. Not only do they have online courses, but they also have live classroom settings. In fact, this year we had 5 of the classes virtual. But we're preparing them to be leaders within the Central Health Enterprise. We're starting our new group in January. And so right now we're in the application process. So we're super excited. Can't wait to come back and share, the promotions that have been provided to these individuals. One of the other exciting things about that program is that if you don't have a bachelor's degree and the job and the position requires, a manager position requires a bachelor's degree, if you are an emerging leader graduate, you qualify to apply for that job. And that's the commitment that we have made as an enterprise to these individuals. Thank you.
Thank you. That is very exciting. I look forward to hearing back from the results. It's very important to provide that kind of ongoing training and continuing education and cultivating that talent within the organization. Thank you very much. Anyone else?
I'd just like to make one comment to what Susan said, if it's at all possible.
Sure.
In Dallas?
It is 10 o'clock, so just so
okay.
Yeah.
I'll be off in a second. In DISD, when they were initially setting up the desegregation plan and bilingual recruitment efforts, what they did is they offered to pay for people who did not have a master's or just had their bachelor's. They paid for their master's or they paid for their PhDs. The school district, so long as that employee would maintain at least 10 years in with the organization. So I just want you all to maybe consider.
Thank you. All right, we're going to move on now to, I believe it's agenda item number 2. Agenda item number 2, and thank you very much for that excellent updates. Agenda item 2, receive a report on fiscal year to date healthcare service expenditures made by and accept the preliminary September 2020 financial statements for Central Health and the Community Care Collaborative, and review historical average revenues and expenses for Central Health. Lisa Owens, I believe you will be presenting again.
Yes.
Thank you.
I'm going to go ahead and start with the last part of that,
Okay.
which is look at the historical trends. You're all familiar with the dashboard that we produced in the past. And I think just to keep it at a high level, our preliminary results, these are our year-end financials. So these are preliminary results, and they are about to undertake our annual financial audit. We are in the midst of preparing for that. So the numbers are preliminary and draft, as always, until you accept that audit in January, which is why this is not an action item this evening. But I thought I would just hit a few highlights as to where we're ending up at the end of the year. There's not a significant change from what we presented in August or what we presented in our summer months, but you will see that our trends continue to have higher net assets, higher cash balances, which we talked about extensively in the budget process. Those additional funds are available and carried forward into the FY21 budget as an available source of healthcare services funds. And some of those available funds were put into initiatives like additional capital reserves if needed for clinical facilities and development. So that is the first trend I just wanted to point out, but you'll notice the steady trend lines, just that we have higher net assets. And again, we've talked historically and extensively about the need for our reserves for one-time events and then for longer-term planning for unknowns. Our sources of funds have stayed very on par with past years, with the uptick here being that we had additional tax revenue this year. We still have about 95% of our revenue is tax revenue, with some of that lease revenue coming from the downtown campus. And so that trend is not going to change at this point. We hope to continue to see those collections in December and January as a predominantly tax-funded organization. But what I will talk a little bit about is the uses of funds. We will start to see this change even more over the next few years. And so the trends might start to look very different because what we had in the past was very large intergovernmental transfers or large one-time expenses in certain months were more of these peaks and valleys. And we're going to start to see that our monthly spend as we are investing in primary care, specialty care, and other healthcare services directly with contracted providers, you'll start to see that the average monthly perhaps go up and those one-time expenditures start to level out. So you can see that a little bit. You see some timing differences here. The current year is FY 2020. You'll see that some of the IGTs were accelerated this year because of COVID. We talked about that, how they were, we sent some IGT up earlier, a month earlier or 2 months earlier at times in order to support response to COVID. But those are some of the trends that you're going to start to see. Just hitting a few highlights on Central Health. Again, strong cash position and current assets at $185 million and estimated just under $11 million short-term liabilities. I will say, as we talked about last year, again, fiscal year end, some of the larger analysis that we do and disclosures that we make in our financial audit, as the campus is demolished, some of those assets will be taken off of our books as the demolition is closer to complete. Last year, the professional office building, for example, was one of those. This year, this year or next year, we will see a larger impact with that larger campus tower building nearing completion of the demolition. Our sources and uses of funds, again, at the very high level, our sources of funds this year, very close to what we budgeted and planned at $298 million. And our uses of funds, again, in some of the healthcare delivery areas where funds were not spent or less funds were spent, such as IGT, those funds are carried forward into this current year, FY21, which we're in right now in October, carried forward as healthcare services contingency reserves. So our administration looks under budget at about just under 8 million of an almost $11 million budget. So 71% of the budgeted dollars there. And again, as we continue to analyze activities, make sure that we have good estimates this year in central health, with more healthcare services that are claims driven, and that 95-day window for claims to be delivered and paid. Although we have a great system in place and great teams, we will be watching and making sure that we have the best numbers as we go into that audit. But don't foresee any significant changes in that space. So again, healthcare delivery expenditures at $148 million. On the CCC, ending the year a very similar position as last year at $27 million in assets and $16 million in net assets. So just about $10 million in liabilities at the end of the year, and a little less than last year, but our net assets remain very similar year over year. In the CCC, we did receive our desert funds, and as those measures are evaluated and audited, we are fine-tuning reserves for any potential audit issues on that. We don't foresee any, and we've never had any, but we do analyze that extensively. And then our healthcare delivery in the CCC, which I'll show you the combined report, is at $16 million, predominantly post-acute care, and that specialty behavioral health, our contract with Integral Care, providing inpatient services and some specialty care. So looking at our healthcare combined report, looking at healthcare services through contracted providers that are provided through the CCC and Central Health. On the primary care side, at about 89% of our year-to-date budget. Specialty care at 56%, behavioral health and pharmacy are very close to their budget, and then post-acute care at just under $2.5 million. And we provided a lot of additional detail on the healthcare services contracts for specialty care. Some impacts from COVID, as we've talked about in earlier presentations, some new services that started up just later in the year. But overall, again, early estimates at about $7.2 million in specialty care. And with that, I will stop sharing and I'll turn it back to you for any questions.
Thank you very much. I do want to note what you said about the more the claims-based. So I'm very happy to be seeing that, and I hope that that trend continues where we are seeing the claims-based. Is that your expectation, Lisa?
Absolutely. Our contracts that are in Central Health now, we have a lot of claims work coming through, and have a great system in place, great partners, and great information.
Yes, I'm really happy to see that. Thank you. Members? Anyone else? Nothing else? Well, thank you. Very useful information, and particularly I know you started with the graphs and charts, and I found those very helpful. Thank you.
Thank you.
Okay, members, if there is nothing else, then we will move on our agenda. We are moving on to agenda items 8, 9, and 10, which we will take up in closed session. So agenda item number 8, discuss and take appropriate action on Central Health owned or occupied real property and potential property for acquisition, lease, or development in Travis County, including next steps in the redevelopment of the Central Health downtown campus, administrative offices of Central Health Enterprise Partners, and new development in eastern Travis County. Agenda item 9, receive and discuss an update on an interlocal cooperation agreement between Central Health and the City of Austin for the realignment of Red River Street from 15th Street to 12th Street And agenda item number 10, receive and discuss the 1115 Medicaid waiver delivery system reform incentive payment, open paren, DSRIP, close paren, projects, the Community Care Collaborative, and other healthcare delivery partners, programs, projects, and arrangements, including agreements with Ascension, Texas. So members, I announce that the board is convening in closed session to discuss agenda items 8 and 9 under Texas Government Code Section 551.072, deliberation regarding real property, and item 10 under Texas Government Code Section 551.071, consultation with attorneys. So everyone will need to leave this video conference and return to the video conference line that we have for closed session. Thank you. We have our quorum, David?
Yes, ma'am. Yes, you do, ma'am.
Okay. A quorum is present. We have concluded our closed session on items number 8, 9, and 10. The time is 10:39, and it is Wednesday, October 28th. We are on agenda item number 13. Confirm the next regular board meeting date, time, and location. Managers, our next Central Health Board of Managers meeting is scheduled for Wednesday, November 18th, 2020 at 5:30 p.m. at the Central Health Administrative Offices, 1111 East Cesar Chavez Street, Austin, Texas, 78702, and or remotely by video conference, depending on the status of the governor's disaster declaration and stay-at-home orders. At this time, I'm ready to accept a motion for adjournment. Is there a motion?
I move adjournment.
I heard a motion by Manager Bell and a second by Manager Jones. All in favor? Aye.
Aye.
Opposed, same sign. Any abstaining? We are adjourned. Thank you so much, everyone.
Thank you very much, members.
Appreciate it.
Thank you.
Good night.
Good night.